Good for streaming? Yeah?
1 second.
Okay. It says we're streaming.
There we go.
Well, good morning to everyone in the virtual world. Welcome to the very first Senior Virtual Expo. We are so excited to be able to bring this event to the public in a safe manner so that you still get all the information that you would be getting otherwise at Reardon Hall in Bella Vista. They have been gracious hosts for decades now to help facilitate bringing information about businesses right in our community that focus on serving seniors and improving their lives. And so because of the pandemic, we are kind of changing with the times and wanted to make sure that nobody was left without these resources. And so throughout today's event, we will have various sponsors and vendors sharing information with you about their respective organizations. And then at the end of this live event, we will be able to take the information that each sponsor and vendor has submitted previously through a video and upload it to our website created just for this purpose. So the information that you get today is going to be available for a full year after today. And so if you happen to miss the live event, it's still going to be out there. So we're really excited. And first I wanted to introduce Tricia Ayers. She is in the room right next to me. We're coming to you live from the facility of Adult Day NWA, formerly known as Village House Adult Day Program. And we have with us a host of co-hosts, and they entail our sponsors and some of our vendors. And so, but Tricia has been working really hard at trying to make sure that the technology goes like we want it to, and that we're still able to bring you all the information possible. So good morning, Tricia.
Good morning. It's nice to be here. And it actually has been a pleasure helping you put this together. During COVID, I feel like I haven't touched base with many of my friends in the senior community. So this was a refresher for me, absolutely. And helping to build the website, putting everybody's videos and information on there was also a refresher. So this has been a great opportunity for me too. So I'm excited to hear what everybody has to say and hopefully help the technology move along during this event and help people with this resource after the event.
Yes. So without further ado, I know that many of our attendees in the in-person event really look forward to the free hot dog sponsored by Concordia Retirement Community. That's always been a huge staple in these events. And the door prizes are a big draw. And so never fear, we're still bringing the fun, even though it's a virtual event, to the first Senior Virtual Expo. And so throughout today's live feed, I'm going to be doing this and showing you the website or the email address that you can register for door prizes. And so the door prizes are still up for grabs. And what we're going to do is collect all of these entries for the next week, and then have a live feed of the winners. And so you'll have a full week to register for door prizes. But today from 10 to 1, Concordia has been a great sport, and they are going to be passing out those yummy hot dogs. So if you're out driving around on this beautiful, almost fall day, I would encourage you to swing through at Concordia Retirement, grab you a hot dog, and then head to a watch party. So thank you again for tuning in. We hope you really enjoy today's first Senior Virtual Expo. So without further ado, I would like to invite or introduce who we have with us today. And I'm just going to go in the order that's on my screen. And I've got Will Corcoran right next to me on the screen. So Will, why don't you unmute and tell us all about your business? And we're really appreciative that Corporate and Financial and Insurance Services is a bronze sponsor of this event. So thank you for your support, and let's hear it.
Well, it's glad to be here. I was thinking, I think this is the 10th or 11th year that I've done this. I was trying to remember. I couldn't remember if I did the first one in 2009 or 2010. But anyway, I appreciate you all fighting through the madness to try to figure out a way to make it happen. And that's kind of what I guess we're all doing. At Corporate Insurance, we have in Northwest Arkansas over 1,000 Medicare clients that we are trying to. Well, we're gonna take care of them this year, but differently, because obviously we can't safely meet anyone face to face or in their homes, like we would normally do. So I'm very hopeful that seniors this year have spent the last few months learning some technology, not only for their doctor visits and maybe nurse visits, but also for things like visiting their family or their insurance agent, or people trying to help them. So the Medicare annual election period starts October 15th and runs through December 7th, and that is the time when people can change their Advantage plan or their drug plan. And everyone, whether they want to change or not, should at least evaluate their current plan. Every year I have people who I see that have maybe never changed their plan. They just kind of roll along with it, and maybe costing them, spending an extra $1,000 a year that they didn't need to be spending. So it's a good idea to get that checked out. October 1st, so another couple of weeks, is when all the plans will go live, and we can actually begin discussing with people the advantages and disadvantages. One thing that's somebody's phone.
Somebody could mute.
There we go.
Okay.
So one of the things this year that'll be kind of new is a little over a year ago, Medicare said that Medicare Advantage plans could start having home care benefits. And we will have this year, for the first time in Northwest Arkansas in 2021, a plan that includes 40 hours of home care visits. I can't say which company, I can't say which plan, but there is one this year that will have that.
When will those benefits go into effect? And is that 40 hours a month, 40 hours a week? What?
40 hours? No, it's just 40 hours a year. It's a 40.
Oh,
it's not going to pay for everything, but
okay.
You figure 3 hours a week for somebody, maybe what they need, and you can spread that out over however long. So it's a good benefit. It's those benefits will start January 1st.
That's so
for
exciting.
2021. Yeah. So a few companies around the country, a few different pockets around the United States had that last year. And so, that's kind of new. We'll see how it goes. A lot of them have, everybody's seen the Joe Namath commercial where he talks about, and I get calls about that all the time. I want that plan. Well, he's not talking about a plan. He's talking about benefits, hoping people call. It's a national telemarketing company of some sort that's advertising. But, here in Northwest Arkansas, our population is such now that we actually enjoy a lot of those benefits that some of the bigger cities, Miami, San Francisco, Dallas, some of those areas have enjoyed. So anyway, so yeah, it is. It's there. We have a lot of good options here in Northwest Arkansas. Seems to get better every year.
Well, and we have to start somewhere, right? So, I mean, maybe a limited number of hours a year and with just one plan or one company right now, but we've got to start somewhere. And so hopefully whatever plan and providers are involved in this new benefit will show that there is a true need for this type of coverage and encourage more plans to participate. So that's awesome.
it is kind of that way. And I also think there may be some people that take advantage of that benefit that happen to have that particular plan next year, take advantage of it. And even if they run through their 40 hours, they may realize, that's something that we need to do.
Right.
So it might spur some additional activity. I do think a lot of people are intimidated by in-home care and asking, well, we know that, asking for help. Seniors don't like to ask for help.
No, they don't. And
So,
that's exactly what we're doing this for.
Yeah.
So how exciting. Wow.
Yeah.
That's the first little nugget that we've gotten. And you're just the first sponsor to even talk.
Breaking news.
Awesome.
Yeah, like I said,
Yeah.
I can't go into details because technically it's against the law to discuss benefits until October 1st. So I probably just broke the law, but I didn't tell anybody which company or which plan. So.
Hey, will you be able to share that information after October 1st?
Oh yeah.
Okay, come on the radio show and tell us about it.
Radio show? What? I've never heard.
I'll tell you about it later.
Okay. All right.
The new thing.
So I will say, if anybody has any questions, they can find us certainly on Facebook or LinkedIn and all those places, or just call 855-6334. That's our office. We are going to see people in the office if they want to be seen in the office.
Good.
Those will be limited. We've spent the last several months getting set up for Zoom meetings, basically. All of the insurance carriers have switched very rapidly to virtual enrollments, to and not just in the Medicare field, in insurance, financial services. There's really almost at the drop of a hat, they were able to switch from ink on paper to, virtual signatures, to phone meetings, phone appointments, and things like that. So it really, this whole, the COVID and the lockdowns and the pandemics and all that has really changed the way all our businesses are done, and forever. I don't think we're going to be going back, minus some of this virtual stuff here, with doctor visits. And somebody from Blue Cross said the other day their virtual visits are up. I mean, it's just some huge number, the virtual doctor visits. So anyway, we've all had to adapt or die, and so I think hopefully we've all adapted.
I hope so too. So before we jump to the next provider, do you want to give a little teaser about your door prize?
It is incredibly thoughtful and difficult for me to get. I'm going to provide a $25 gift certificate to Walmart. Yay! Because your boy here forgot to go get anything clever because my wife's working and not helping me. So
that's okay.
But hey, it'll spin.
That's right. And
it'll spin.
There's a number of things you could buy for yourself or for somebody else for $25.
Absolutely. A lot of hand sanitizer and face masks.
That's right. Awesome. Thank you so much, Will. Okay, next on my screen is Miss Christy Dennis. Good morning, Christy.
Good morning. Good morning.
So let's hear all about your organization.
Oh, good. It's such a privilege to be on here with you all today. And we're so excited to be with you on the senior fair. And just thank you all for putting this together where we could all be together today in our separate places. So I'm with Dignity Memorial. We are the largest cemetery, cremation, and funeral provider in North America. So we have over 2,000 locations. And so what that means, we have two funeral homes here in Northwest Arkansas, Callis and Low in Bentonville, and then Rollins and Rogers. And what that means is that we actually are able to, if one were to move away and they had to go back to a different home state, or maybe where their children were to take care of grandchildren, that type thing, this plan would go with you. So that's an amazing benefit of ours, is that it's national plan transferability. So that's one of the largest benefits of being one of our families.
Yeah. So you mentioned the business about cremations, but that's not even close to all you guys do.
That's right. We take care of everything, any kind of a cremation package. If it's a cremation that the family is traditionally interested in, or possibly full body burial with a traditional funeral. So we do funeral services, memorial services. We've done so many different. We can make it look exactly like the family wants to be remembered, and customize and personalize, and so it's really just all about how the family envisions that.
That's so important. Now, Christy, how common is it for your clients to have already in place a prepaid burial service? Is that very common? Because I hear about it a lot, but I don't know if that's actually very popular. Could you talk to us about that?
Sure. And actually, a lot of folks, we're one of the things that people procrastinate about, and we all do it because it's about our mortality, and it's not the easiest thing to think about. But we help navigate that portion of things and that process, so that it's really as easy of a process as possible. And it really is, we walk hand in hand with you to figure out what is best for your family. And I don't run across a lot of folks who have prearranged, but that is my specialty. I'm the prearrangement specialist. And so what that means is that I will meet with the families. We're probably one of the most, as you can imagine, sanitized places on the planet at the moment. So we are actually meeting families face to face in the funeral home every day. We sanitize after each family leaves. So we're very, very careful. Everyone has their mask on and such. And then also we do these virtual seminars. We do virtual appointments. And like Will was mentioning, we can do everything online now that we can do in person. So that's really a wonderful thing.
It is.
And so
Oh, no, go ahead. Sorry.
oh, no, I was just going to say, so the prearrangement part of things is what I take care of. And it's such a gift to the family, because when it is, those arrangements are made ahead of time, the family doesn't have to wonder what would mom have wanted, or what would dad have wanted. And it's just such a gift to the family. And another huge benefit is that it freezes the cost of the funeral to go ahead and prearrange. So no matter if one uses it in their payment paying years, or 30 years down the road, your family's not going to pay any more. So that's a huge benefit.
Okay, that's so good to know. And when it comes to prepaying for your funeral or your memorial service, can you include things like the flowers and any additional fees that might be kind of add-ons there at the end, maybe the programs or things like that?
Yes, good question, Sarah. Yes, in fact, our packages are customized really to include everything that would be added into, would need to be used at that time, as far as with a memorial service or with a traditional funeral service. The flowers are included. Yes, so we have packages and significant package savings on all of our packages. So I'm so excited to be able to share that information with folks. And if I can just hold up here, I have something called our personal planning guide. And this is an amazing tool that our families just love, and have told us repeatedly that once it's filled out, it's just invaluable. So this is just a comprehensive tool that documents all of your wishes, and everything just in one tool, one booklet. So it's really a huge benefit for the family. So I'm so excited and looking forward to being able to present that to our participants.
Yeah, that would be one of the giveaways, right? That would be sitting on your table.
That would be, well, actually, what we do love to do, if possible, is I love to sit down and share it with the family and present it. It's a complimentary guide, but I love to present it because there are so many benefits of being one of our families. And so, so I would take be a great honor to be able to present that to each one that I could meet with. That'd be awesome.
That is great, Christy. And I do want to encourage everyone that is tuned in, if you have questions for the sponsors, for the vendors, don't hesitate to type them in the comment section. And then as well to our other sponsors and vendors, maybe if you haven't chimed in yet, but you have a good question that you think maybe somebody else is thinking. I mean, this is pretty chill. I want it to be comfortable for everyone. And so just kind of act like we would at Reardon Hall, minus the hugging and sneezing on everybody. Okay. Christy, before we hop to the next sponsor, I just want to say thank you guys so much. Dignity Memorial Services is another bronze sponsor of this Senior Virtual Expo. And do you guys have a door prize yet?
We do. I want to show that to you. I'm having a hard time keeping it here and not tearing into it. This is a huge, wonderful basket from lots of cheese and preserves and pancakes and syrup. Oh, it's beautiful. It's from House of Webster.
Nice.
So it's yeah, it's a beautiful one. So I look forward to seeing who gets to take that one home.
That's exciting. Well, Christy, thank you so much. And if anybody would like more information on either Rollins Funeral Home or Callison Low, or maybe you're out of the state, this is a nationwide company. So definitely reach out to Christy. And what's the best number that they can reach you at?
That's my cell number. It's 479-957-0102. And that's on my business card. I think that's on the website there with you. But yeah, that's I'll love to get in touch, back in touch with you. So thank you so much for your time, Sarah.
Thank you, Christy. And next is our only gold sponsor for the event, Springwoods Behavioral Health. Sharon Ledbetter is with us this morning. Good morning, Sharon.
Good morning. Thank you and Tricia so much for providing this platform for us to get our information out to the community. This is incredible.
Well, it's definitely a need for us to be able to get the information out there for the public one way or another. And I know we would all rather be in person and get to socialize in a different manner, but this is what we got right now. So we're just lemonade, right?
That's right. That's right. And Sarah, we've been friends for so long. You know, I'm a hugger. So
I know it's hard.
Yeah, it's so hard. It's so hard. And being in mental health, it makes you even more aware of the struggles that everyone's going through right now. So, you know, you can't have good physical health without strong mental health as well. And we are seeing a significant increase in major depression. People are isolated. So Springwoods Behavioral Health is set up to be Northwest Arkansas's emergency psychiatric ER. We operate 24 hours a day. You can walk in if you are feeling depressed, if you feel like, you know, you're just hopeless, if you're seeing people, you know, if your family members or yourself are experiencing delusions, you know, hallucinations. There's so many things that can contribute, the isolation, you know, that we're all feeling, you know, that lack of family involvement, that lack of being out in the community. Those are all things that we can assist with, whether it's inpatient or it's through telehealth services. We launched, one of the positive things that came out of this pandemic is it's forced a lot of providers, including us, to move to telehealth services. So we're able to provide from your own home. It's a platform just like this. where you can visit with counselors and do a partial hospitalization program. So that is something that we're very excited to have there. We have a specific senior adult program. It's called Silver Springs, and Dr. Gary Linker is our medical provider on that program. Our average length of stay for a stay there on that unit would be anywhere from 7 to 14 days. It just depends on what is going on with your loved one. Very, very excited to have him with us. And of course, Dorothy is our therapist back there. She's incredible. Everyone, I think, knows Dorothy. So we're just really excited to be here, Sarah, and be able to provide this service to Northwest Arkansas.
Oh, and we're so appreciative too. There is a great need, and I know today's event is focused on serving seniors and different providers that focus on improving their quality of life. But I know that you guys also serve people starting at adolescence, right?
That's correct. We actually start at age 12 is our adolescent program. And then we have the only center for women in Arkansas as well. And it focuses specifically on depression for women, postpartum. We work closely with Hub of Hope, which is an organization here in Northwest Arkansas that assists with, rescuing sex trafficking victims, drug traffic victims. So we are domestic dispute. It's a special program.
It certainly
does get to focus on women. And then we have our adult unit, which is also an alcohol and drug detox. But then we can also deal with those psychotic, schizophrenic people who have come off their medication. They need stabilization. So we can help those individuals as well.
That's great. Now, mentioned last week a little something about National Suicide Prevention Day, and I know that was last week, right?
Yes.
So
yes.
Mental health and suicide go hand in hand, and I know that's something incredibly important, and specifically with our seniors. So talk about some of the resources that Springwoods Behavioral Health has to specifically address any type of suicidal ideations or attempts or struggles.
Sure. So the Action Alliance is one of our closest partners with our parent company, Universal Health Services. And in 2017, they did some studies that said that older adults who attempt suicide are more likely to use lethal means and die than younger people who attempt suicide. That's shocking. And that's something that is just, and it's typically men who are age 65 or older are almost 4 times as likely to die by suicide than an adolescent age 15 to 19. Those are just alarming statistics that are just, people don't talk about. So that's why I'm so pleased to be on this platform and be able to talk about some of that education, because we do have to intervene with our seniors, especially now more than ever. Look for those signs and symptoms.
Yeah, absolutely. And especially with this pandemic and the increase of isolation and just uncertainty that definitely piles on to that mental health instability and just questions that a lot of people wouldn't have even considered thinking before. I mean, is it even worth living in this time and era?
Right.
Those
very true.
And so it's very important that everyone understands what Springwoods has to offer for not just your typical depression or personality disorders and behavioral issues, but suicide is a really big problem right now. And you guys are certainly giving it some due diligence and helping in a lot of ways that I wouldn't have otherwise known about. So thank you.
Sarah, and we've also partnered with the Bella Vista Fire Department. Chief Sims and Ronnie Coupler there, they have a community paramedic program, and we have partnered with them. They do the community paramedic program, so they're coming out to individuals' houses. They are visiting with people. They're They're helping with labs. They can do rapid COVID testing, you know, if someone's needing to go to the ER. So we've partnered with them to provide our services if needed. And it avoids an ER stop, a medical ER stop. If it is truly just a psychiatric issue that's going on, they can come straight to us. Ronnie and Chief Sims and their department can clear those individuals. They call us and they can come straight to our facility. So it is such a blessing to have them in Bella Vista and serving that community. It's incredible. I've known Chief Sims for, I don't know, too long, longer than I'd like to admit to date myself, but they're just incredible. They're incredible up there and they provide such a good service. So we're happy to partner with them.
Awesome. And any last words about your fabulous door prize?
Our door prize is a snack box. It's probably got about 35 items in it, ranging from little breakfast items to, you know, our protein-based Jack Link's turkey or bacon or beef sticks. Yeah.
That sounds yummy. Vendors, don't get any ideas about registering, okay?
So Sarah, if anyone has questions, if they ever, you know, are looking for other services, they can call our office line at 479-973-6000 and press option 1. We have a licensed clinician or an RN that will answer that phone, and you can just ask them some questions about, you know, what's going on with you or what's going on with the family member. And they can provide you an assessment, a no-cost assessment. And then they can also give you some references out in the community. We have so many great providers in our community. So
we really do. And Springwood's Behavioral Health is definitely one of them. So thank you so much, Sharon.
Thank you.
Yeah, we look forward to seeing who wins that nice snack box.
Thank you.
Yeah. Okay, next on my screen, I believe is Springhouse Village. Is that you?
Is anybody there?
Unmute your phone. Push unmute. No, push, can you unmute them, Trisha?
I'm asking them to unmute. I don't see it.
Hey, Sarah. Can you do what's the website again for the door prize?
Yes, absolutely. To register for door prizes, it is seniorexpo.services@gmail.com. And you'll need to put in your name and phone number. That'll be up for a week. So we'll be taking those registrations until next Thursday, which is the 24th. Yes, the 24th. And we'll announce them and notify the vendors and sponsors of who got their prizes. Okay, now
I see, I'm sorry to interrupt. I see one phone that isn't able to unmute, but I see another iPhone that is unmuted. And my eyesight is not very good. Hi, how are you?
Hi, how are you?
Yay, there you are.
And
That's better.
Okay, I'm Patricia Fall, Marketing Director at Springhouse Village.
Yeah.
Springhouse Village is an assisted living level 2. We also have a memory care. We have 100 apartments altogether. We are all inclusive, meaning that all of our everything's for one price. Then we have our door prize here. Let's see if we can show this. No. So what this is, it's a fall decoration set. This is our door prize.
Awesome.
Okay.
That looks like fun. Now, Tricia, tell us a little bit about how long you've been serving the Northwest Arkansas community. And we did definitely want to say thank y'all so much for being a bronze sponsor. I know that we want to include the entire Northwest Arkansas community, but for a lot of or the majority of our sponsors and vendors are out of Benton County. So that doesn't quite fit your geographic area. Aren't you in Fayetteville?
We are, yeah.
Yes.
We're in Fayetteville.
Okay.
And we opened last November
Uh-huh.
of 19. So we've not been open very long, but our company, the Foster Senior Living, they've been serving this community probably from over 10, 12 years. Yeah, because they opened a couple other buildings before. So we're excited to have this building open. It is beautiful. We have several courtyards. We have fountains, babbling brook. We have a theater. We have our dining room is exceptional dining. It is, everything here is really exceptional. You know, we work towards excellent care for our residents.
Mm-hmm.
You know, we try to go with the changing needs, you know, that seniors often have.
Mm-hmm.
So, yeah.
That's awesome. Now, do you have open apartments or rooms right now? Are you accepting new residents during the pandemic?
You know, we do have some openings. We're doing the virtual tours.
Okay.
And like most communities, we do the COVID testing. So we are safely moving people in, and our people are, you know, they're doing really well.
Good.
Yeah, living vibrantly, you might say.
Good.
Yeah, and then we have our outdoor visits with the families, and that's going very well. Yeah.
With this lovely weather, I could only guess that it should go well.
Yes, it is. It's going well.
Well, good.
So, and you know, we try to meet the needs of the family too. This has been, you know, a different time, to be sure. And I feel like that, we've done very well with all of this. Yeah, I feel like our residents, they seem to be doing really well. They're happy.
Well, that is great to hear. And we just want to say thank you for participating in the event, for being a bronze sponsor, and for bringing all the information to the community. No matter what form it's in, the information is good to have. So definitely, if you have any questions or want more information about Springhouse Village of Fayetteville, what is the best way to contact you?
You can call directly to our facility, or you can call me. It's my personal is 417-763-5623, and then you can go to springhousevillage.net, and we like us on Facebook. Check us out. We've got a lot of exciting things going on.
That's great. That is great. Thank you so much, Patricia.
Thank you.
And okay, next on my screen is Miss Lisa McClelland. You unmute there.
Okay. Hello.
Hi, how are you?
Hi, I'm Lisa McClelland. I'm a regional manager with the Area Agency on Aging. I'm in the Fayetteville office. So, as all of you have stated, the COVID pandemic has changed a lot of things. However, one thing it did not change is our continuation of providing our services. We haven't stopped. We've remained open, and we're still meeting clients face to face in their homes, and we're still providing care. So the main difference for us, in March, we started with the PPE immediately. So all of those precautions are in place, and they have been since March. We followed all CDC guidelines and immediately got those into place. The only thing we haven't been able to do is to open the senior centers for the gatherings. are disappointed. They're missing their bingo and they're meeting together. However, we have a center who has done a drive-in bingo with the PA system and the parking lot, with the car hops and the food as their fundraiser. So we've adapted as best we can, but everything else is maintained and continued. We're mindful of the additional needs that this has caused. So again, we immediately located those needs, especially for food, and we made sure the meals were delivered. Meals on Wheels did not stop. Meals on Wheels has continued throughout. And so we've been mindful of that. Our farmers market coupon distribution, we continued with that as well. Normally we have the big sign up events at all the senior centers. So this year we could not do that and we did this by mail. But we continued to distribute those coupons so seniors can have their fresh fruits and vegetables. And even though the shopping times and methods were adjusted, we didn't want them to miss out on their nutrition and getting their food. So we continued with that as well and made sure that happened. We still have coupon books available so they can give us a call. They're good through October 31st at the farmers markets.
Okay.
So still call us for that. Our care coordination is still alive and well. Like I said, they're meeting the needs through in-person home visits, and they're continuing to monitor all clients for what they need. So that has continued. We're getting ready for Medicare open enrollment as well. So again, our technology and our methods have adjusted somewhat on this. We're not meeting them face to face as we were before, but we're ready and we're excited. And we're proud that we've been able to stay open and continue with our services and still meet with our clients and be that in-person contact, even though we have the PPE and we can't hug them right now. But we've been able to go to the home and meet on their porch or 6 feet away. But we've still been that presence for them in person, and our caregivers have been as well.
Lisa, could you tell me for Meals on Wheels, is there a criteria that the senior has to meet for Meals on Wheels, and how do people go about signing up for Meals on Wheels?
All of our clients who are on the Our Choices Medicaid waiver program and they have meals on their care plan can get their meals. So that is paid for and included on the Our Choices program. And for everyone else, they can call the senior center and ask for Meals on Wheels, but they'll need to be age 60 or over if they're not on Our Choices.
Okay.
They need to meet the criteria of being homebound and not having a way of obtaining reliable, a source of getting their groceries or getting their meals where there's something lacking and some barrier there. But the senior centers would be happy to help with that and go out and assess the situation.
I have a question about Meals on Wheels as well. Does it matter how far out you live in order to get Meals on Wheels? I mean, what if you live way out in the country?
We have several of those. Typically what the center will do, it will be the senior center in that area that's closest to that area. And typically what they'll do is they'll send out frozen. So they'll make one trip a week and send out 7 frozen and put them on a schedule and on a route that fits, and they'll go to that area, but they can still do that.
And what about people who have restricted diets and still need assistance with meals? Are y'all able to accommodate for like a diabetic diet or a heart healthy regimen?
Typically, not to the extent that a hospital or a facility would be doing.
Sure.
That criteria, and we can't take the sodium out and that kind of thing. For diabetics, we can send a fruit instead of a dessert and make that adjustment.
Okay.
Not to the extent of a hospital diet, but
sure. I was just curious about that because I know that for a lot of, at least our participants here, who may have some of those services on days that they're not here, they have restricted diets, and I wasn't sure what that looked like for Meals on Wheels. So just curious about that. And what about your door prize?
We have a $25 gift card to Walmart.
Nice.
So easy to get out to our winner whenever.
Yeah, that's awesome. Well, what is the best way for someone to get a hold of you, Lisa, if they need more information, or maybe they're just getting started and really don't know what they're eligible for? How can they reach you?
That's what we specialize in. Not only do we do in-home care, but we do everything. We're trying to help them with their services with DHS, with Social Security, with their Medicare plans, and food resources. So we're kind of taking care of everything. So if they call the office of the county where they're located, so in Benton County, they can call 479-273-9424. And Washington County is 479-442-5194.
Okay, great. And just to clarify, is there an area agency on aging in every single county in every single state?
Yes.
Okay, so maybe you were watching this live feed and have never heard of it, or wonder, you're not in Arkansas or you're not in Northwest Arkansas. Could they still reach out to you and you connect them with their local agency?
Yes.
Awesome.
Yes.
Awesome.
Our agency covers Northwest Arkansas, and we cover a 9-county area of
Okay.
Arkansas, but we can refer to any others as well.
Wonderful. Lisa, thank you so much for
Thank you.
Involved in the program and serving our seniors that need it so much. We really appreciate it.
Thank you.
You bet. Okay, Miss Nancy Foster is up next on the roster. I have been waiting to say that. Nancy Foster, next on the roster.
Unmute. All right. Hey, how is everybody?
Good. How are you?
Good. Good.
That's great.
Appreciate you guys doing this. This is kind of one of the things I've learned with all the Zoom meetings is for professionals. I've gone to a lot of the networking groups, even obviously I've worked your Expo for years, but you may see faces and you get to know a few people, but the Zoom ones, you're actually getting, I love that people's names are on the screen. You're actually almost getting more information than you get lots of times with the face-to-face. So,
Right.
So I appreciate it very much. I do caption telephones for people with hearing loss. So I have my lovely poster behind me here, but it is a federally funded program that provides CapTel. So CapTel is the company that makes the phone. My company is actually the service arm of CapTel, which is OEI, which is Outreach, Education, and Installations of CapTel phones. That's a mouthful. But this is a federal program for anyone with hearing loss. They can get a phone. This is just one of the models that we have. We also have a couple little smaller white phones, but this is by far the more popular one. The phones are amplified. They write out the words of the person that you're talking with. And my favorite part is they save that incoming conversation. So I always say I hear okay, but I forget easily. So it's pretty awesome to be able to go back and review what someone said to you. And so you can go back through the call history and review that incoming conversation and make sure that you understood it correctly. They also all have answering machines that write out the message as well as verbalize it and are amplified. And they all hold between 95 and 100 phone numbers, and you can put some of those even on speed dial. So they're a pretty incredible program. And to qualify, someone has to have some level of hearing loss and have a doctor, a nurse, a hearing provider, either an audiologist or a hearing aid person, or a licensed social worker, or a veteran service officer. Any of those people are qualified to sign off. And I have a specific form that I would have to get to you if it's not someone that I work directly with that has my forms in their office. So that's the qualifier to get it. And then normally we would come into the home and set it up, but because of lovely COVID, we are still on somewhat restricted on coming into the homes, but we will ship the phone and we do a over the phone installation. We always ask if you have a family member or a friend that can hear a little bit better, but the phones use an internet connection, a phone line connection, and electricity. So they plug into your router, plug into your phone jack, and plug into electricity. So it's not brain surgery to get it set up. And it's pretty helpful for the people that really can use the program. So, you know, it's a great program. This is my form. So it's literally a one sheet that you just put the person wanting the phone's name and address, the person signing off on its name and address. You guys that have assisted livings and daycares, a lot of you have nurses on staff. It can even be an LPN that signs off on it. So if you have any of your clients that would benefit, please get in touch with me and let me know, and we'll get them fixed up. So it's a pretty great program, and it's just, you know, people, it's been around for over 10 years, and we're just trying to get the word out there. So we all pay for it through a small tax on our phone bill, and it's funded through the Americans with Disabilities. So people always like, what's the catch? Well, the catch is you pay 3 cents on your phone bill already for it.
Okay, so maybe next time I get my Cox bill, I won't get as bitter whenever I see taxes, fees, and surcharges.
If you see, I think Cox writes it out as the program for the deaf and hard of hearing. It's like, it should be about 3 cents.
Okay,
So
well worth it.
Yeah, not too many of those taxes at the bottom there go to us, but
Wow.
But it's as I said, I know, like the assisted living that we were just Spring House. Sorry, wrong spring. Got too many springs going on. You know, if they provide internet and phone lines, then it's a great one for it's just a great way for people to be able to communicate. Especially, we're finding because of COVID, people are staying home, and even the people that had decent hearing aids, and they would kind of go out and lip read, and the little old guys that meet at Chick-fil-A on Friday mornings for coffee, they could fake it well enough to kind of understand the conversation and get through it. But a lot of those people are now not doing that, and so they're stuck at home. And we were talking about behavioral health and suicide and things like that. Well, depression issues and hearing loss is actually very well connected to depression, actually increased heart disease. Dementia can be up to 5 times greater with untreated hearing loss. So it's my public service announcement is always like, get your hearing tested and at least see where you're at. We all go in for mammograms and eyeglass tests and all this other stuff, and everybody puts off hearing tests. But it's really good anytime over your 50s to just go in and have a baseline screening done. And then if you qualify, then you can get a CapTel phone for free. And if you're working from home, that can be a huge blessing. If you're just trying to stay in contact with friends and family, it's kind of interesting. I've done a couple phone drop-offs for, one was a home health nurse and for her family member who was going into an assisted living. And she's like, we haven't been able to talk to him in, 2 weeks because they're not allowed in the facility. So those people that, were all kind of visiting and able to kind of check on their family member now can't do that in a lot of instances. So that makes the CapTel phone a lot even more valuable. And to have that connection where, grandma can talk to the grandkids or, anything like that really does help with their mental health. So I encourage you, if you do have anybody that wears hearing aids or just has hearing loss, untreated hearing loss, to contact me and we'll get them fixed up. So
thank you so much, Nancy Foster. And you want to give a little teaser about your door prize?
Oh, and I have one more thing.
Okay.
We have a new thing that we're putting out. We're all trying to reinvent ourselves. And this is our new little magazine. It's actually a newspaper, and it's several pages. It's very good quality, and it's different articles that are geared towards seniors. And if any of you guys would like them personally, or if you would like them for your clients, I can mail you a packet of them. We're going to be doing this quarterly. So it's actually been really, really well received because our demographic likes newspapers, and they're not getting their newspapers that much anymore. And it's geared towards more towards seniors. So, and my door prize is a Walmart gift card. So $25. So
Thank
you
you
very
so
much.
much, Casey Foster with Captel Outreach. And if you are just tuning in, welcome, welcome, welcome to the very first virtual Senior Expo. In lieu of the big in-person event that we would typically be hosting at Reardon Hall in Bella Vista, we are kind of jumping on the Zoom bus and doing it virtually. So welcome. We've invited various vendors and sponsors that have participated in previous events in person to share with us a little bit about their organizations. And then at the end of this live event, we will have a website dedicated just for the sole purpose of your convenience to go to when you need it to get, again, all the information. You don't have to worry about keeping up with business cards or brochures. It's all going to be right there at your fingertips at your convenience. So thank you so much for tuning in. And like so many attendees, I'm sure the viewers are really excited about the door prizes. We have quite a few already that we're excited about. The best way to get in the running for door prizes is to send an email to this seniorexpo.services@gmail.com. All you need to put is your name, phone number, and we're going to be collecting those entries all week, and we'll announce the winners next Thursday. So stay tuned for that. And let's see, the next on my screen is Miss Caroline. If you want to unmute your screen and tell us all about the organization that you're with.
Yes. Good morning, seniors. How are you guys?
Good.
So I'm with Miller Butler Law Firm in downtown Rogers. So we have offices in Fayetteville and in Siloam Springs. So we serve Washington and Benton County. We do everything involved in aging, right? So we cover your wills, trusts, powers of attorney. We do adult guardianships, and we also handle Medicaid work. So anything involving long-term care. Yeah. And so last year when I was at the Expo, I actually had a different last name. So I was married this year, and I'm actually on my honeymoon right now. So I'm in my casual clothes. I'm not at the office, but I couldn't miss the opportunity to say hi to everybody. So last year I was Caroline Courier, and this year I'm Caroline Courier Bladdock. Well,
congratulations. I hope you're having a lovely honeymoon, and thanks so much for doing this, even though you're on your honeymoon. Where are you?
So it's kind of funny with the wildfires and everything that happened out west. We were supposed to go to Napa Valley, and now we're in Fredericksburg, Texas, which also has vineyards. So it's right outside of Austin.
Oh, wow. Definitely have a glass of wine for all of us. Just call it a taste test and enjoy your honeymoon. So we're really excited that Miller Butler Law Firm is another bronze sponsor of this event. So thank y'all so much for your support. And in addition to some of the services that you just mentioned, is there anything else that you would like to share with the viewers about the law firm?
Sure. So our law firm, we have an attorney that specializes in every area. So I think it's pretty unique. None of us are general attorneys. So we all handle things that, we're experts in. And I will say for my practice, the elder law practice, I really run my practice on compassion and guidance. I'm heavily involved with my clients and their family to the point where I'm always saying, we need to do this, or we will do this. And then I forget, wait, I'm not actually a Jones or a Smith, or, so I really like to be really involved with my clients and give them that quality of service.
That's awesome. If someone in our community or someone tuned in would like to get a hold of you, or maybe not honeymoon, what's the best way to get more information about Miller Butler Law Firm?
Sure. So the best way to get information about us would be to call 479-621-0006, or you can send an email to elderlaw@arc, so like Arkansas, but ARK attorneys.com.
Awesome. And if you're on your honeymoon, you probably don't know what the door prize is, do you?
I do. So as an attorney, we love to read. And we know I love that my seniors also are reading a lot right now, because that's one of the main sources of entertainment from home. So what we did is we have a $25 gift card to Barnes & Noble.
Nice.
Yeah.
Well, thank you so much. And you just have a blast on your honeymoon and a safe trip back.
Thank you. Thanks for having us. And y'all have a good day on here. It's looking good. I'm enjoying it.
Oh, good. Thank you. Share it. Share it. Okay, next up for the Senior Virtual Expo is Jason Kelly. Jason.
Hi, everybody. Yeah, I'm Jason Kelly, and I'm with Washington Regional Faith in Action. And we have a program, obviously, for senior adults, and it's across Washington and Benton County. We're a volunteer. Basically, they're the backbone of our program. We have a coordinator who works in Benton County and a coordinator who works in Washington County. So we have over 70 volunteers who take care of senior adults who are homebound. And when there's not a pandemic going on and life is as it should be, we offer transportation to medical appointments, grocery shopping, home visits. We have a food pantry and a paper good pantry. And I can say in the last few months, we've really been blessed by donations to our pantry and been able to take lots of shelf-stable food and paper products and adult garments to our clients. Kept our two coordinators busy because we haven't been able to have volunteers since March. So we're doing the best we can right now. We are still taking on clients as we can. We're real hopeful to be able to get our volunteers back mobilized in the weeks ahead and get our program back to 100%.
That's great. So Faith in Action has been another staple in many of our Expo events. Do you know how long it's been serving the community?
Over 20 years. Over
20 years. Wow. That's awesome. Jason, I see a nice basket sitting behind you. What's in that basket?
Yes, it's a 17-piece kitchen tool set, a 22-piece culinary set, and 3 incredible cutting boards on the bottom.
Oh my.
Yeah, it's a great.
That's pretty fancy. That's pretty fancy. Well, Jason, is there any other information? Oh, Trisha, what do you got?
Yes, I actually have an interesting thing. Jason, somebody called me the other day, and they generally get Faith in Action cuts their lawn, and they hadn't had their lawn cut in forever. And she's a shut-in lady in the country, so I need to get with you afterwards.
Yes, definitely.
She's on your roster. Yes.
Yes. Absolutely.
Okay.
You've got
Y'all
my
cut lawns?
number. Go ahead.
You cut lawns?
We do, yeah, like minor projects around the house. Oftentimes we get groups that want to volunteer, and we've built handicap ramps. We've done lots of cleaning, window washing, things like that, just to mobilize folks and for seniors that are homebound. It's been interesting during the pandemic in the summer. A lot of our volunteers have gardens, and so they've been doing these phantom door drops of tomatoes and fresh garden produce at the door, and then they'll run out to the car because the senior adults want to come out and give them a hug. But I'm pretty sure none of our volunteers that are doing door deliveries, non-contact, haven't given hugs, but we told them not to tell us if they did. But something cool that we actually did, we have a committee that kind of gives us oversight. We went out to Stay in Step Blueberry Farm in June, and we all picked blueberries, and we took, I think, about 6 pounds of blueberries, divided it up among some of our clients, and took them blueberries. So it was pretty fun. So pretty excited to have that. So
that's awesome.
Trying to keep it real.
That's right. Keeping it real, keeping it fun, keeping it safe. Thank you so much, Jason Kelly. And if anyone wants more information about Faith in Action with Washington Regional, how is the best way to get a hold of you, Jason?
Yeah, the easiest way is to look at our Facebook page, and that's Faith in Action NWA. Or you can just shoot me an email. I'm jkelly, Kelly, at wregional.com.
Awesome. Thanks, Jason.
Thank you.
Okay. Next up on my screen is Mr. Kerry Lingenfelter. He could probably hear me better if he just put his ear to the wall because they're my neighbor next door. Let's see. Home Instead Senior Care is a silver sponsor of this first Senior Virtual Expo. Good morning, Kerry.
Well, good morning, Sarah, and good morning, everybody that's participating today. It's great to see all of you. Many I haven't seen in a while, so to be able to connect with you virtually is fulfilling. So grateful to be here. Home Instead Senior Care has long been a supporter of the Adult Day NWA program, and we're very grateful to get to participate in this way this year. We are neighbors, so we would love to cordially invite those that have an interest in their loved one to come to the Frisco Station Mall, look in through the beautiful picture bay window that Adult Day has, and kind of see the goings on that really do enrich the lives of their participants over there. So we are next door. We've been here for many, many years. We've been serving Northwest Arkansas for about 20 years as well. We are a professional in-home personal care service, specializing in memory care and cognitive care needs. So about a decade ago, we began really focusing on all things dementia related. And so certainly many have heard of Alzheimer's, but there are many, many categories of cognitive disability under the dementia umbrella, and we are well versed in all of those. This year has taught us how to be more than just technologically friendly. And so our service has been enhanced by a home care tablet that we provide to our clients and community members that help connect them in the way that we're all being connected right now. And so we're excited to talk a little bit about that with everyone that's viewing. And if you'd love to know more, we would love to share it with you. So please reach out to us or check out our website. It's homeinstead.com. We have a door prize as well. We felt like many were probably doing this new online shopping. And so we felt like we wanted to give them a tool with that. So we have a $25 Visa gift card that can be used for any of their favorite shopping outlets. So we'll be happy to get that over to Sarah and Trisha so that they can draw the winner and get that out to them.
Yeah, and so if you're just hopping on, here is the email address to register for all of the fabulous door prizes. We are going to be accepting registrations for these door prizes all week. And then on the 24th, we'll be announcing and contacting the winners. So that's a really good one, Carrie. Is there anything that you feel like you wanted to share with the attendees or the providers that are joining us right now about Home Instead Senior Care or anything else that y'all have got going on?
Yes, so certainly we have been addressing a pandemic that's been going on far longer than the one that we've all been dealing with this summer. And that's the social isolation pandemic. And so we just really want to encourage our community members to either participate in a program like Jason Kelly's and Faith in Action, where you can give back to a community member, or we have a Pen Pals program where you can actually write letters to one another and have that engagement. But definitely addressing social isolation is really important to us this year. And we have many ways of doing that. So those of you that are joining us on Facebook right now, I would encourage you to check out Ready to Care. We have a social platform that you can check in weekly and get great ideas on how to impact the life of a senior in our community, and just some really great tips, some great ways of doing that. And we want to encourage people to participate in Ready to Care.
Absolutely. Thank you so much, Carrie. And we're just happy to have the support from Home Instead to be a silver sponsor for this event, and encourage anyone to reach out to him for any of your in-home care needs, or if you need some ideas about social isolation or just how to help a senior. Thank you so much. Okay, coming up next, Mr. Jan Watkins. Come on.
Good morning.
How are you this morning?
I'm doing great. How about you?
We're doing good. We're doing good. We haven't had any technical difficulties, knock on wood, so far.
You're doing better than I did. I had some.
That out loud. I'm not sure what I was thinking. So Jan, tell us about your organization.
Okay. I work for Fairway Independent Mortgage in the reverse division. Now, I think if you watch my clip after a while, you're going to see I say, you know, the thing that most people say is at our age, because I am a senior too, we don't want a mortgage and we sure don't want a reverse mortgage. And I want to tell you, everything you heard about reverse mortgages about 10 years ago is true. All of those bad things you heard is true. But it's now an FHA program, and it really meets your needs. Like I said, I'm a senior. I personally have one. I have grandchildren. I have children. My wife and I would not do anything that would hurt our legacy to our children. So that's how I feel about it. It's a wonderful program for you to be able to use your home to stay at home. Maybe you need home health from Carrie, but you may not be able to afford it. This is a way that you can use your home to be able to age at home. I'm really excited about it. And just a little bit about me, because I moved to Northwest Arkansas a year ago last summer from Oklahoma via Seattle. So you can see I was way out. So we came back to this part of the country to retire, or for my wife to retire after 37 years of teaching. And she grew up in Blytheville. And like I said, I grew up in Oklahoma. So we're back home. We wanted to come back home. And when we got here, I saw the need that people were not presenting reverse mortgages to seniors in a good manner. Seniors were calling 800 numbers. There was no personal interaction, which, man, I'm missing right now because I love talking with people. I want to sit and tell people about reverse mortgage. I don't want to sell them a reverse mortgage. I want to educate them about a reverse mortgage. And if it meets their needs, that's great. If not, I've educated one more person. So that's my philosophy. By the way, I've got some material I'd love to bring to you. I can either mail it. I can meet you somewhere and we can socially distance, or I can put it on your doorstep. I don't mind doing that a bit.
Okay.
My goal is to get people educated about reverse mortgages.
Awesome. Thank you so much, Jan. Trisha, I am having a battery problem. I just jinxed.
Oh no.
I'm gonna let you take it over while I try to fix this. I'm gonna mute myself.
Yes, ma'am. I was just posting something, so just bear with me a second because I'm getting back to my screen.
I tell you what, let me show a couple of books that I can get to people. This one is called The New Reverse Mortgage. This tells a little bit about reverse mortgages. I'll be happy to get that out. I also have a book. If people like to read, this is a great book, and it's called Home Equity and Reverse Mortgages: The Cinderella of Baby Boomers. It's an untapped equity. There's over $7 trillion in untapped equity in our homes.
Oh my goodness.
Wow. That's more than's in 401ks and everything else.
Yes.
That people can use for help with their retirement.
Well, thank you very much, Jan. We really appreciate that. And I appreciate you were very good in this whole process to email me so swiftly and send me all materials. So thank you so much for that.
You're
I
more than welcome.
appreciate that. So while Sarah fixes her battery issue, we won't go into that. I did get a message from Cindy at Concordia, and she said the hot dogs are ready. So if anybody is in the Bella Vista area and would like a hot dog, you can drive into their parking lot, and they will do as touchless hot dog serving as they can there. Those are always delicious. Those, is it Nathan's hot dogs that they serve all the time? Those are fabulous. So I will move along. I feel like we're in, is it the Brady Bunch? The Brady Bunch situation here.
Hey, Tricia, I've got my, my gift certificate I didn't tell about.
Oh, please do.
It's a gift certificate, not a gift card. It's from Allen's, Bella Vista's very own Allen's grocery store. Actually, one of my wife and I's favorite places to eat. We live in Springdale, not to eat, but to shop. We love going out there. So I thought that was something that people could use too.
Oh,
so,
yes.
$25 gift certificate to Allen's Foods.
Go see Steve at Allen's, and steaks are good at Allen's. People like to spend their gift cards on steaks.
Very good.
Thank you so much.
You're
Let's move across. I'm going to go across to Jen Edwards. Jen, how are you? Can you unmute yourself so I can hear you?
Yes, here I am. Hi.
Great. Tell us a little bit about House of Three.
Sure. So yes, I'm Jen Edwards. I am with House of Three. And House of Three is an innovative alternative to senior care. And we have a 1-to-3 ratio. So we have 3 seniors living in a home setting, and we provide 24/7 care for those seniors. So each senior has their own private room. We provide all their meals and care. If any transportation, we can arrange that. And so just what makes us different is that we only have 3 residents, and we're in a comfortable home environment.
One thing I did notice when you toured me, it's just like being at home. So I think that is a very encouraging setting for a lot of people who need extra care. One thing I also liked, you had cameras in the common areas, so family members, not everybody, could tune in and check in on their loved one. I think that's so important. Sure. So important right now, obviously.
Sure, yes, we have those cameras set up so the family members can see not only to the common areas, but into the residents' room as well, if they choose to, if that's something that they're interested in doing. And we can also keep an eye on things that way, just kind of a peace of mind and just full transparency. I'd also like to just explain where I am. I am at one of the houses. This is our back deck, and all of our houses have some sort of back deck or patio where the residents can get out and just enjoy sitting and watching the birds and the squirrels and just getting some fresh air.
I think that's a wonderful thing.
And we have a nurse that comes out as needed, and she's on call. She comes out very regularly. And then we have a medical director that he makes house calls. Right now they're virtual, but he is also on call for us and is able to help us whenever the resident needs their help.
Where did the idea for House of Three originate? Where did that come from?
Well, my husband, Shane, has worked in long-term care for 25 plus years. And so he and a colleague saw a need for just something different, something, maybe a little more personal, the 1-on-3 care. Also to be able to help, those with dementia, Alzheimer's, just kind of on a smaller setting.
So if people want to, are you doing any virtual touring? What are you doing right now?
Well, as long as we can do the social distancing and follow all the guidelines, we are allowing some tours in-house, taking the temperature and washing hands and all of that. We can do a quick tour that way, and then we can visit on the back deck. And the same with our visitors right now. We are allowing visitors for the residents, just as long as they let us know when they're coming, so we don't have very many at one time. And we do encourage the visiting outside if possible, but yes, we're always following the proper guidelines and the masks and everything.
And if anybody listening or watching would like a tour, how do we get hold of you, Jen? What's the best way to get hold of you?
Yes, they're welcome to call me, 479-270-2710, or they can call Shane at 479-270-9975. And they're welcome to visit our website at houseof3.net if they want more information.
And where are your properties? Are they in?
Yes, we have 2 in Rogers, and this one is one of the Rogers locations. And then we have 2 in Bella Vista as well. And right now, currently, we have an opening in Rogers and an opening in Bella Vista.
Oh, so if somebody's watching and is thinking about changing their lifestyle, they can call Jen if that's what they're interested in. Lovely.
That's right. That's right.
Do you have a door prize, Miss Jen?
Well, we're working on that, but I do have that beautiful fuchsia plant back there and a t-shirt, but I think we're going to add, something with it, maybe a gift card. So I haven't decided where yet, but yes, I think that's the plan.
I think you certainly have the best background for your portion.
Thank you. Thank you. It is so nice out this morning. So it was just seemed like the place to be.
I want to come hang out and drink some coffee on that.
You bet. That sounds great. Come on over.
Okay. I'll be busy for a little bit.
Okay. Sounds good.
Thank you so much, Jen. Say hi to Shane for us too. And thank you
for having us.
House of 3 for being a platinum sponsor of the Senior Virtual Expo. We're so excited. I'm so excited to be here and to at least get to see some dear friends' faces and colleagues that we've worked with for years. And one of those that I just miss seeing across the parking lot has popped up on my screen, Miss Leslie Austinfort with the Rogers Adult Wellness Center. Good morning. How the heck are you? There you go.
Good morning. Can you hear me now? It's so good to see all of you.
You too. So what is the latest scoop for the Rogers Adult Wellness Center? I have been asked, I don't even know. I wish I had $1, just $1.
I would be a rich woman for sure. We actually don't have a date yet. We're definitely moving closer. You probably watch, we're still here every day. We're still coming to work. My staff has learned new skills. They've been painting our facility and keeping busy so that we can continue to keep everyone employed. And so we're very grateful that the city has continued to allow us to keep all of our staff on while we've been closed. And we've been giving ourselves a facelift so that we'll have like a fancy new look or a refresh anyway. So definitely we're preparing for opening. We're researching all the different options. What's so challenging, of course, for us is that we serve, like everyone else, the most high risk population, but it's also a high risk activity because it's heavy breathing and you have to allow people to be unmasked while they're exercising. And so we have restrictions right now set of 12 feet apart. And so we definitely are researching different things that we can keep people safe and be able to be open. So we're definitely hoping. We miss everyone so much. We miss our members. Many of them are coming and walking outside and at least on our outside trail. So we'll wave and be able to socially distance. But unfortunately, I don't have any news as far as our date of reopen at this point.
Well, that's okay. One thing that I just love is, on the radio show, we've had a few people call in on different weeks and say, when is the Adult Wellness Center going to open? We miss it. It's such a great resource. And I cannot express to you how important your organization is to our seniors and our community. And I absolutely love the fact that almost every morning, if it's not pouring down rain, there is a huddle of socially distanced, either men or women or both, sitting in a circle, still socializing. And that just really speaks to the kind of camaraderie and like the familyness of the group of people that you guys serve, and it's beautiful.
Yeah, we definitely are much more than just a gym. It's a community of people, and we're talking to our members, we're calling them, and many of them are saying they're really missing their friends and just the interaction that they get at the center, not only the exercise. And so of course we understand that, it's been a real difficulty because that's a big part of people's lives is coming to the center. It was their regular schedule for years. And so we're excited for it too. We look forward, many of our members are like family to us because this September, we're turning 14 years old, and we have members that have been with us every single year. And so they really are like family.
Well, congratulations, 14 years. That's cool. That's a big deal.
It is a big deal. Yeah.
Yeah.
It's like my other child.
In a lot of ways, probably more so. Just, yeah, hear ya. So we don't have a date yet, but as soon as we do, I'm going to need to lock you in on sharing that with us so we can tell everybody, because everybody just cannot wait to get
Absolutely. We're sending out virtual newsletters and hard newsletters still to our members. And so we're keeping them apprised and letting them know of some of the changes that we know that will happen. Some materials that they'll have to wear masks in and out of the building. They'll have to wear swim shoes now. There's different things that we're cluing them in so that they can be purchasing stuff so that they can be ready ahead of time. And so we'll definitely let you know that. And we will look different, absolutely, when we reopen because of the different restrictions. But I still think people will enjoy coming in, even if we have to really watch and reduce a lot of what we've been able to offer in the past, just to be able to open our doors again.
Sure. So did you get a door prize ready?
We did, yes. So we got a little cookbook kit here. We have two, you can't really see them. We covered it up, but some Pioneer Woman little spatula set and a cute little towel for the kitchen, and two different cookbooks. One is our anniversary cookbook that's our members' delicious recipes, which people really enjoy. And then another one is a cook that is famous in the area, Kay Burns. She was a caterer here for many, many years. She's one of our members, and she donated her cookbook as well. So we have a couple of cookbooks, and so we are happy to get that to whomever wins.
Okay, well, Leslie with the Rogers Adult Wellness Center, thank you so much for being involved in this really staple of an event. Even if it's virtual and not in person, the information is really what we're wanting to get out there to everybody. So we've enjoyed talking to you as always, and look forward to an upcoming big announcement.
Absolutely. Good to see you.
Okay, next on my screen is Miss Kaylee Bush with Primrose Retirement Community. They are a platinum sponsor of this year's Senior Virtual Expo. Good morning, Kaylee.
Good morning, guys. It's good to see everybody. It's been a while. Sorry, what?
I said you look beautiful.
Oh, well, thank you. So I'm with Primrose Retirement here in Rogers, Arkansas, and I have our executive director, Sabrina Lawrence, with us. Hi, everyone. Hi. She's been with our community here since we opened. Actually, even before we opened, she was our director of nursing here, and back in January took over the role as executive director. And so just kind of wanted to introduce her to everyone. So here at Primrose, we are an independent living, community assisted living level 2, and a memory care. So we offer a wide variety of services and amenities here at Primrose and Rogers. So just wanted to announce that. And if anyone has any type of nursing questions or over the services that we can provide, Sabrina is always a great resource for everyone. So.
Sorry, I muted myself for a second. Well,
that's okay.
It's so nice to see your face. It's been a really long time.
Yes.
So tell us a little bit about what services your staff can provide for the different levels of care.
So with our levels of care, we make it specifically patient-centered based. So we get to know the resident, who they are, what their lifestyle has been prior to transitioning in here, and how we can capture and promote that independence and quality of life. So with nursing, we drill down specifically on the levels. One resident may not require any type of assistance with MedPass, but may need help with showering for safety. Or another resident might need help with all ADLs and MedPass. So we can move with that resident as they progress with the aging. We can also progress with their care. So it allows us to staff and provide that more direct care.
Awesome. And where are you guys located?
So we're located on 650 South Dodson Road in Rogers, Arkansas. So basically, it's J Street running south. Everybody's like, I don't know where Dodson is. So it's J Street running south. It just comes over to Dodson. So
Gotcha.
And we
McAllister's?
Yes, by McAllister's, Zaxby's, Walmart to go, all of that.
Okay, gotcha. Great central location.
Yeah.
Do you guys accept pets?
Well, yeah. Pets are your family too. They're part of your home.
I'm not saying that they're not family, but some facilities have different rules. And so that's a very important question for a lot of potential residents. And I just wanted to see if you guys accepted pets or not. How much does it cost extra to have a pet?
It's a one-time $1,000 pet fee.
Woo!
So you better love that pet.
Okay, great. What about a door prize?
We've got 3 door prizes, switching on over here. Okay. So first place, we've got a $50 Hobby Lobby gift card.
Nice.
Second place, we've got a lantern.
Cute.
And then third place, we just have a Primrose goodie bag that has one of our coffee mugs in it or tumblers. And then a $10 Chick-fil-A gift card.
Wow.
So we're excited.
Yeah. Okay. Y'all take the cake right now for best door prize. We didn't say it was a contest, but if it is,
well, we're in it to win it,
That's right. Okay, Kaylee, is there any other information that you want to put out there for any of the viewers who either watching live or will be tuning in a different way later?
Yeah, I'm still doing the dementia series. So that's something that I was running on site before COVID. And since then we have adjusted and we're doing them through Teams meetings. And so if you guys have anyone or family members who are interested, this month we're going to be talking about how to enrich the lives of your loved ones who have Alzheimer's and dementia, and just how you can modify certain activities or daily tasks to fit where they're at to meet their needs. And so every month is just kind of, we'll go over different tips and tricks on how to help your loved one, and also just open it up for support and open discussion from our participants. So please, if anyone would love to join that, we would really, really love to have you. We want to reach the community with our education that we have on that. So.
Okay, so that's not exclusive for your residents. That's for the community, public people, just people,
Yes.
People, right?
Yes, ma'am. So all you've got to do is give me a call and give me your email address, and I'll send you the invite. So best way to get a hold of me is call 479-271-7120.
Thank you so much, Kaylee and Sabrina with Primrose Retirement Community. We're incredibly thankful to have y'all as a platinum sponsor of the first ever in history Senior Virtual Expo. That is what's going on right now. So if you're just getting tuned in, thank you so much. We are talking to all of our vendors and sponsors that would otherwise, if it weren't for COVID, be in person, having a big old time, and a big old Nathan's hot dog at Reardon Hall in Bella Vista. And I just got word from Concordia Retirement Community in Bella Vista that the hot dogs are ready. And so all you have to do is take a nice drive up there. It's a beautiful day. Why not? And get your free hot dog, take it back to a friend's house, have a watch party, get all this wonderful information, and register for a door prize. All you have to do is send an email to seniorexpo.services@gmail.com. Include your name, phone number, and we're going to be taking registrations all week. And then next Thursday, we will announce winners and make sure that all these fancy door prizes get to all you fancy people. So next up on the list to talk to is none other than the one and only Allison Van Hickey. Good morning, Allison.
Hi, how are you guys?
We're just loving it.
I know, this is a long day for you guys.
It's fun.
I know, it is fun to see everybody's face. I love it.
Yeah. So what's going on with the Lighthouse Group?
Well, for those of you who don't know, Lighthouse Group is a group of real estate agents that are specifically trained to work with seniors during the downsize process. So we've received extra training to help with the emotional aspect of the move. And not only that, but we're pretty good real estate agents, so we can get you the most money for your home. Along with that, you know, we started the Lighthouse Group and realized that a lot of people just have more issues trying to figure out how to get through their stuff. And so we created a company called Handle with Care Move Management. And Handle with Care Move Management works with you from the beginning to the end, taking care of all the details, helping you sort through what you need to take with you to your next home, and you know, how to make it all happen as stress-free as possible. That's us.
I'm getting a little bit of feedback from someone, so if you could just mute your phones. We're really happy that you're tuned in, but just want to be respectful of the vendors and sponsors. So if you could just please mute your phones while the others are talking. But definitely, if you have a question or comment for any of the sponsors or vendors, or just in general about today's event, please feel free to enter those into the comment section below, and we'd be happy to address it as they come along. Now, Allison, I know you did the Senior Truth Series last year, which was a huge success and had wonderful feedback and provided a lot of helpful information to the community. And, you know, like everything else, COVID. So do you think that maybe whenever things settle down, or maybe when we get rid of this pandemic, that's something you might start up again?
Well, we've been doing it. We continued. So we had, you know, just like everybody else on here, feel really called to make sure education is in front of seniors, and that we help them plan for important decisions, you know, well before a crisis time. So we did not feel like we should stop what we were doing. The mission hasn't changed. In fact, I think it's gotten even more important to get information out to people. So we went online, and we've been doing it through Zoom. We still have our same website, which is www.senior-smart-talk-.com. Had to put the dashes in there, otherwise it looked like Seniors Mart Talk. So anyway, you can go on that and register for our Zoom calls. We do them every second Thursday of the month. So yeah, that hasn't stopped, but we would love to get back into person, and we will as soon as we can.
Okay. I just wanted to clarify, I did know that you were doing the virtual thing, but I meant like the in-person, the panel.
Oh, yes.
You know.
Yes, as soon as we can meet in large groups, as soon as it's safe to do so, we will definitely reinstate that.
Awesome.
We've appreciated all, and we have such good panelists each month. A lot of people on this picture that I'm seeing have been on my panels, and just really great service and information. So thank you.
Yeah. Okay. What about your door prize?
Well, my door prize is going to be a gift card to Walmart.
Walmart gift card.
We can't not have Walmart, right?
I mean, they're not even paying us to plug them.
I know, right?
Yeah. What in the
Yeah,
world?
but if anybody is looking to downsize, we are very COVID friendly, if you will, with our requirements. We're following all of the protocols that anyone else is following with the mask and sanitizing and making sure we keep social distancing. Because I know that's a big fear for seniors is having people come into their home, being around others, but we're being as cautious and careful as we possibly can be during the moving process. And we make sure to communicate with all of the different communities that we move in, so we adhere to their rules as well. So
that's awesome. Well, Allison Van Hecky, thank you so much for being involved, and we look forward to the day that we can all meet in person and listen to another great senior Smart Talk. So thank you.
Thank you, Sarah.
All right, next on the block, we've got Miss Amanda with Lifeline of NWA. How are you?
I'm doing good. How are y'all doing?
We are just happy to be here, and I am enjoying this. Before you get started, I do want to say hi to Carol. Is it Carol, Jen? One of your residents that's tuned in?
Yes. Oh, yes. This is my friend Susan.
Susan. I'm thinking Carol. I don't know why. Sorry. Hey, Susan. I'm so glad that you're tuned in.
Oh, thank you.
I think you got a big wave whenever you first popped into the picture. So I just wanted to give you a special shout out. Okay.
Oh, all right. Thank you.
Yeah. Okay, Amanda, back to learning all about Lifeline of NWA.
Yes. So we are a personal response service. I know a lot of people have heard of, like Life Alert. So that's very much what we do, but we're here locally in Bentonville. So, obviously a lot of seniors like to live independently, and with that, can come risks of falls or accidents that way. So with our system, if they have an accident, they can push their button, they get through to dispatch, and then dispatch lets either the EMS or fire department know that they had an accident. And then we always do a follow-up with them as well, just to see how everybody's doing.
Yeah. And how long has Lifeline been around? Because, man, it seems like they've been around for a long time.
They have, yes. Going on like over 30 years now. So yes, yeah, it's definitely, and always here in Northwest Arkansas, happy to serve everybody.
Absolutely. Oh my gosh, what an important service. And don't y'all work pretty closely with Home Instead Senior Care?
Yeah, I mean, we try and reach out to any type of senior care, obviously within the area. It's just one of those things, we like to get to know everybody. And obviously, the service we provide is a life-saving service. So as many people that we can get to know about it, the more I can say.
How much does it cost to have Lifeline?
We have different services. So for instance, I just brought one out here. This is one of our Bell systems, and this actually is on Verizon, but you don't have to necessarily have Verizon service. So this starts at $29.95 a month, and then there's just a one-time $40 installation fee. And with Lifeline 2, you can cancel at any time, or say you get this product and you don't necessarily like it, we have other products that you can use, and we swap those out.
Awesome. Now, is that something that you have to charge every night, like your cell phone?
There, like I said, with which each system has different charging capabilities. This one can actually go without charging for over a month. Their systems, the Bell Plus, which actually has a fall detection, with that, since there's a little bit more capability there, it is one of those that we ask. It's just good to charge it every like 5 days.
Okay.
So, kind of like how you put your cell phone on a charger or every night, same system.
Okay. Is it water resistant? Like, are you supposed to wear them in the shower? Because I know a lot of happen in the shower.
Yes, exactly. I know that's obviously kind of number one place. So again, we have several different systems, and there's some of them that can be worn in the shower, at night, when you go out and about and everything. So yeah, and that's part of our series of questions that we like to ask everybody. You know, are you active? You know, are you staying home? What system works best for you? And then we're able to kind of tailor to everybody's needs.
That's awesome. So tell us a bit about your door prize.
We have a very beautiful watch combo here.
Nice. Is that a bracelet or like an interchangeable ribbon?
Yeah, it's sorry. Like my daughter's on Zoom meetings all the time, and she's like a professional. I, on the other hand, am not doing so well today. So
you're doing great. Hey,
yes.
Everybody is doing great.
It's watch and then a bracelet.
Cute. All right, I gotta write that down. I'm trying to keep track of everybody's door prizes, so whenever it's just it helps me.
Hey, I totally understand that.
Oh my goodness. Amanda, how can somebody get a hold of you if they need Lifeline or if they have a question and need more information?
Yeah, absolutely. We're on Facebook, of course, and our website is lifelineofnwa.com. And again, we're here in Bentonville. There's only 3 of us that are in an office at the same time. So we are here, and obviously I don't have a mask on today, but if anybody comes in, we have our mask on, and ask they wear their mask as well. So yes, we're very, very much open and still trying to get out there. Deborah does our installs for us on Tuesdays and Thursdays. So we're still in the field trying to get work done.
Awesome. Well, thank you so much for your involvement in this expo. Thank you for the services that Lifeline of NWA provides. And we hope that somebody, I know somebody, a lucky winner, will really enjoy that cute watch and bracelet.
Yes, hope so. Thank you all so much for having us. We really appreciate it.
Thank you. Before I jump to our next sponsor, I do just want to talk a little bit about my organization, Adult Day NWA. You can see in the background the logo. And on my fancy shirt, my activities director made for us, her name's Jenny. She'll pop in and out occasionally. And in a little bit, I'll take the computer out there so you guys can see what kind of fun action we have going on here in Rogers, right next to Homestead. But our program has been taking over this Senior Expo for what, Trish, like 4 years now, I think? Yes. And it was really handed down to us when an organization out of Bella Vista decided to dissolve. And they had, put together these events, and it's really the only day that the community had set aside to bring together senior-focused providers. And at one point, it was just a health fair. And whenever we took it over, decided to bring in a little bit more than just the healthcare providers, because people like CapTel and people like Lifeline and people like Faith in Action, who are not, and Lighthouse Group, that aren't healthcare providers, but so critical in making sure that our seniors in Northwest Arkansas receive top-notch quality care and improve their quality of life to the fullest extent, which is really what Adult Day NWA is all about. We provide respite care outside of the home. So when our participants come to the program, they are usually in the beginning a little bit reluctant just to get out of that comfort zone and to get away from their safety blanket or their caregiver. And our staff are really gifted and talented in making our participants feel safe and comfortable. And once we can establish that, it's really easy to just start having fun. And we do that quite well. And we do that every day, and well, Monday through Friday. And our participants are 18 or older. They have all types of disabilities, special needs, seniors that have different Parkinson's or different types of dementia that come as much or as little as they need to or want to. And we are a nonprofit organization. And so this expo is our most consistent fundraiser that we've had, something that we certainly depend on for the funding, especially right now because we are operating at a limited capacity. And so your involvement and your support for this specific event today means more than it ever has, because we are really struggling like so many other businesses right now. But I just wanted to touch on that so that you truly know how important your involvement and your support is to the financial health of our organization. So thank you so much for that. And I'll talk a little bit more in detail about the different programs that we have. But for now, I would like to talk to Miss Debbie, who is from Magnolia Place. Good morning, Debbie.
Good morning. How is everyone?
I'm great. I'm having fun.
Me too. It's been a busy morning. That's why I jumped on late. I'm so sorry.
That's okay. We've had plenty to talk about. So nobody would have known you were late if you didn't just tell on your.
Darn it. I shouldn't have told them myself, but I missed a lot.
That's okay. So tell us all about Magnolia Place. Magnolia Place is located in Rogers, and they are a silver sponsor for this event. So thank you so much for your support, and you've got the floor.
You bet. We're a silver sponsor because we love NWA.
Thank you.
We're a memory care facility, which means we care for people with Alzheimer's and dementia. We're not just an assisted living, we are memory care.
Mm-hmm.
Standalone memory care, so that doesn't mean we just have a wing for memory care. Everything is memory care in our facility. We gear our fun around what we call meaningful moments. And the way we develop our meaningful moments is with the beginning of our residents coming in and a great interview we get to do with the families. So to know more about that resident, their passions, their careers, their lifestyle, their hobbies, their habits, just basically their history. And then from that, we make a biography board with their picture. We put it up by their door. And that works as a springboard for our staff. So if we have a resident that might be anxious or scared or lost or angry, we can pretty much look at that springboard and say, oh, Mr. Jones used to work for the railroad. Maybe I should talk to him about trains and calm him down a little bit. And we found this to be a great tool. Our staff gets to know a lot about our residents, and their treatment is totally different because they know everybody as an individual. And then that gears off to our programming, which is run by Miss Angie, which everybody loves.
Yes.
So they're getting fulfilled through spiritual and physical and being creative, almost like you down by you, Sarah.
Yeah. Yeah.
We have a lot of programming going on. We live for programming.
I can speak to that. And I did just want to share with everybody, if you have been invited to one of these lunches with Debbie and you haven't gone, you truly need to go. And I'll tell you why. I was brought to tears in a good way from what I learned in just the hour-long lunch that we had. Not only was the food amazing, but Debbie had these forms to fill out, and I didn't know what to expect, or, sometimes you kind of have an idea of like what kind of group activity you're going to participate in. So you already figured out, oh, I'm going to answer it this way. And it was just general questions what's your favorite, or no, like if you could paint a room any color, what would it be? And what does your, day look like if you have the whole day to yourself and finances are not an option? What kind of music makes you happy? Where did you grow up? Just kind of basic getting to know you questions. And then our partner, we would give the information to our partner across the table who didn't know this information. And Debbie instructed us to develop a care plan for your partner based on the information that you have. And I just thought, oh, this is awesome. And it gave us so much insight into how we could be a better caregiver, how we can better empathize with these seniors that we're working with on a daily basis. And, it's so easy to get burned out or to kind of get stuck in a rut and having the same conversations over and over again. And so to have that new perspective, that twist on things we should find out about the people we care for and about the people we're taking care of and work with, it was a beautiful thing. And if you ever have an opportunity, you need to do it. And I copycatted that, Debbie, and I did an
Good. Good. I'm glad.
In the same respect, because it just really makes you think about it. And it's a fun way to learn some stuff about each other, that you wouldn't have known otherwise. So it was cool.
If I haven't invited you to one of my lunches, COVID has been bad.
Yeah.
Yourself, call me up and say you want to go to my next one.
It's really fun. It's really
yes, fun. Yes. And you talked about the lunch and the food was great. We have a great chef. And herself around meaningful moments as well. Finds out what these people like to eat. Most of it, she does a lot of down home Southern cooking, which I'm in love with, although I'm a Yankee. But she's a true chef. We got our 3 meals a day going. We got our alternatives. We got the 3 snacks in between because, these people like to walk and be busy all the time. And we don't want them to get skinny on us. So we're time. Yeah. But they love the food here. She's an excellent chef.
Well, she made a pretty mean chicken pot pie that day that I still
okay.
Sometimes. So hats off to the chef for sure.
Yes.
Debbie, tell us about your door prize.
Oh, I'm a Christmas buff, just so you know.
Okay.
And boy, do I love the Santa Clauses.
Ooh,
yes, he is absolutely adorable.
Oh, okay. Christmas Santa.
He's an old Santa.
He's so pretty. Is he like an old world Santa?
Yeah.
I love that. That's so pretty. Well, what other information? Hey, give us some contact info if more information about.
Okay. Phone number to contact me. Just call our business number, which is 479-636-0799 and ask for Debbie. If I'm not available, Andrea, our administrator, is a wealth of knowledge. She can answer any questions you have. Actually, she's one of our trainers for the validation therapy, 1 of 5 in Arkansas that's allowed to do that training.
That's huge.
My email address is debbie.cousineau, COUSINEAU @jeayourliving.com.
Thank you so much, Debbie.
You're welcome. It was my pleasure.
Well, Magnolia Place in Rogers is one of our silver sponsors for the first ever in history Senior Virtual Expo. It's going on.
Yay!
Of course, we would all, prefer to be munching on a Nathan's Hot Dog sponsored by Concordia during this time outside of Reardon Hall. However, you can still get your free hot dogs at Concordia Retirement Community from now until 1 o'clock today. So if you're hungry and don't feel like making lunch, you can't pop over to Debbie's place, but you can go through the drive-thru at Concordia and they will hook you up with some yummy hot dogs in true fashion for this Senior Expo. So thank you so much for all of your participation and for hang in there. We've got several other vendors and sponsors that want to bring information just to you about, and also make sure that you are sharing this event online. You may not be a caregiver, you may not be a senior, but I promise you know somebody, or somebody is following your feed that is. So I would really encourage you to share this event, tell your friends, tell your family. It's going to be collected on a website with even more detail about each organization on our website, which is seniorexpo.services. So that website will be ready tomorrow. And but the registration for all these fancy door prizes is going to be open until next week. So if you want to get your name in the hat for a door prize, send an email to seniorexpo.services@gmail.com. Okay, on to our next, let's see, I don't have any pictures of people, I just have names. Leah Fitzgerald with Blue Wave Hearing, come on down. Can you hear me? It's a hearing place. Leah. Leah. Okay, we can come back to Leah. How about Dessa or Disa?
Dessa.
Dessa, how are you this morning?
Doing pretty good.
Can you turn your camera on so I can see you?
I'm having technical difficulties this morning.
Tell us what organization you're with.
I'm with Healing Hands of Mercy Massage Foundation, which was founded here in Rogers by Joey Gall.
I'm writing this down. I didn't have you on the list, but I'm so glad that you're participating. Okay, and y'all are in Rogers?
Rogers, yes.
Okay, good. Now, if we were having the in-person expo, y'all might be one of those vendors that would provide like a free hand massage, right?
Yes, we would probably have some of our therapists there to do some chair massages.
Okay, well, I can wear a mask and y'all can just come to my office. If you'd like. I'm only halfway kidding. Tell us more about what your organization does.
Well, the organization was founded in 2008, and it was an idea that came to Joey while she was actually in the hospital fighting for her life. She had an illness that they didn't know a lot about, and was having a hard time, and she had asked if she could get a massage, and they said, well, you need to have your checkbook ready because your insurance doesn't pay for that. So she vowed there that she would open up a foundation that would provide massages for those in need, like cancer patients or people that are just having stress. And we provided, it's not based on income, but people that put in for massage requests, it's just based on need. And then once the therapist sees them a couple of times, they determine whether they need to continue the massages or, just kind of based on the each person. We offer three massages at first, and then we just take it from there. We have a relationship with Circle of Life where we have massage therapists that go in there. We also have a partnership with Highland Oncology, and have had those for several years now.
That is awesome. If someone would like more information about your organization, what is the best way for them to contact you?
Our website is www.hhmms.org. We are also on Facebook, same abbreviation, HHMMS. Or you can contact myself at 479-790-5544.
Awesome. Well, is there any other information that you would like to share with the attendees or the providers? You've got their undivided attention.
One thing I did fail to mention is our massages are not only for the patients, but they are for the caregivers and loved ones that are taking care of those patients. So we offer the free massages to them also.
Well,
yes, because they need it too.
Worth mentioning. Yes, that's a big deal.
Sarah, I was thinking that would be a great thing for them to come to Adult Day.
I know. Y'all should, yeah. I'll get you hooked up with our activities director.
Okay. I did send in a
House of Three.
Yeah.
Okay. I sent a video into somebody. I'm not sure.
That was me.
Oh,
yeah, Trisha. She's been the my techie.
Yeah.
Awesome.
Yeah.
Awesome.
Yeah. Well, Dessa, thank you so much. We are just thrilled that we were able to hear all about your organization and hope to be able to see your face in person at some point in the not too distant future.
Okay.
Okay.
Thank you, guys.
Thank you. Is Blue Wave tuned in yet? I see Leah Fitzgerald, her name box, but I don't see.
Right. I keep asking her to unmute. I don't know whether, work comes up like everybody else, and maybe she had to step away for a few minutes.
Yeah, probably.
So,
let's see. We talked to Jason Kelly. We talked to Jason, Amanda. Let's see. Sharon's on there. Nancy Foster. We talked to Nancy. We did. How's it going at House of Three, Jen?
Well, it's going well. It's going well. I'm just out here with a couple of the residents, just enjoying the outdoors. And
yeah, that looks fun. It looks so peaceful and relaxing.
It is. It is.
Man. Well, I smell who we got over there. Hello. Hi. We wish we were sitting on your porch.
Oh, yeah.
We wish we were. That looks so nice and inviting. Man, what a way to do long-term care living, huh? Who'd have
Well, we think so. Thank you.
Yeah. Okay, what I'm going to do, because I smell food cooking, I'm going to take y'all for a little walk through Adult Day NWA. Special little treat. And so here we go. I hope this works. Okay. Let me put my mask on. I'm gonna let y'all say hi to everybody. Let me stick this on. This is truly a live event. So no swear words, everybody. Okay, here we go. I'm going to walk backwards into our multi-purpose room. Look, there's Shane. Hey, Shane. And Tom. What are y'all working on? Oh, how cool. These pictures literally come to life after you color them with the touch of an app. It's so cool. What's it called? Quiver. It is so cool. And there's some of the ladies over there. And then I was also going to take you into the kitchen so you can say hi to our cook, Miss Kim. Hey, what are you cooking?
We are having.
I'm on Facebook.
Oh, hello.
There's Miss Kim. She's our cook. It smells delicious.
We're having sausage with fried cabbage and fried greens.
Fried greens, cabbage with bacon. Oh my gosh. Look. Oh, that looks and smells amazing. That's just one of the meals that Miss Kim makes for our lovely group at Adult Day NWA. And it smells so good. And I'm getting hungry. So we have, I wanted to talk to y'all about our door prize today. It is a Visa $25 gift card. And if you want to register for any of the gift or the door prizes that you have seen so far and the ones that are coming up for later, there is only one way to do it. Sorry, I'm plugging my computer back in so the battery doesn't die. The best way, the only way to register for a door prize that you would otherwise be winning in the raffle at Rudin Hall is to send an email to this address, seniorexpo.services@gmail.com. All we need is your name and your phone number. And we're going to be allowing people to register for these door prizes through next week. So on Thursday of next week, we'll be announcing the winners. And I mean, so far we have a lot of really good ones. And we're excited to learn about. So there are several other participants, or not participants, vendors and sponsors that aren't going to be in the Zoom call today, but on the website that gathers all this information that we've put together for you. They will have little videos that they've created about their respective organizations. And they will also have the contact information. So you don't have to collect a bunch of business cards. You don't have to grab a brochure on your way out. It's all going to be right there on the website. And that website is seniorexpo.services. And so if you can't catch all of a piece of our live stream today, but you want to tell a friend, refer them to this website so that they can get the respective information that it is they are needing, because it'll have categories of different types of organizations. Trisha, do you want to talk about that just a little bit?
Sure. Absolutely. So I'm just putting the finishing touches to it now. It is live, but it still has some work going on. I'm still adding people's information and videos. We broke it up into sections, discussing with Sarah. So there's medical services, long-term care, financial, insurance and legal, and community service. So we broke it up into those categories. We thought that would be easier for everybody to navigate it. So, and it's a very simple website, very easily managed, nothing fancy about it, but it has your logo, it has links to your websites and contact information. And then all of those folks who sent me videos, some sent a very personal message about their services, that's on there also. So we're hoping that that is going to be a great resource for the next year. And we can go in and modify that as the year goes on if there's new information, but we'll certainly be doing our best to get that resource out there to all the seniors and also those of us who come into contact with seniors. I know it refreshed my memory considerably about everything everything that everybody offers when I was putting the information in. So I know the marketing community will be thankful for that resource. I know all of the churches in Bella Vista especially are going to be using that resource, as well as the city of Bella Vista, and hopefully the city of Rogers and Bentonville are always getting calls from seniors looking for resources. And I know they're going to use this to guide people and be educated about it. So I'm very excited about that.
I am too. And I think that yeah, we hate that we're not being able to gather and socialize in that respect. I love being able to see everybody's faces without masks, because now I know that they're smiling or that they're not. But what's so nice though about this platform is that if you can't make it to the in-person expo, if you can't get around to all of the vendors, that's okay, because all the information is stored on the website that would otherwise be there, that you might remember some, you might forget to stop by a certain booth. That's all okay, because all the information is at the website. And so regardless if the event is live, if it's in person, you're getting what you're going there for. And unless you're just going for a door prize, and in that case, you need to send an email to seniorexpo.services@gmail.com, all the great door prizes. This is the way you're going to get to register for those wonderful door prizes that our gracious vendors and sponsors have provided today. And you got to see a lot of them. There's a lot of them you haven't seen too, because there's a lot of people that we haven't even heard from yet. This event is going to be going on live until 1 o'clock today. But just because our live feed ends does not mean that the information still isn't out there, and that you can't still register for a door prize. One thing that's not going to happen after 1 o'clock are the free hot dogs that Concordia Retirement Community in Bella Vista is handing out in a safe way. So if you go right now to Bella Vista, go through the Concordia drive-through, they're going to hook you up with a Nathan's hot dog, just like you would get at the in-person expo at Reardon Hall. So that's really the only thing that's going to totally end at 1 o'clock. This is going to be an ongoing thing. And of course, the door prize registration will be going on through this time next week. So,
and Sarah, I know you kind of mentioned this, and we talked about this a lot, that I know personally when I'm at the expo, I am great at picking up the free pens and the candy. But sometimes it doesn't click who I've been talking to, because I'm there to get the goodies also. This way, I think people could spend a little bit more time looking at the resources. And also, if anybody after the event wants to post anything on our Facebook page, they need a contact, I'll be more than happy to direct them. If somebody goes, okay, Debbie was mentioning something and I'm not quite sure where Debbie is, I will get that information to them. So please use this as a resource. We just want to keep that information going out there, definitely.
Absolutely. And let's see, a couple of the people that we haven't heard from that we really are looking forward to that have been sponsoring this event. The first one is Arkansas Blue Cross Blue Shield. They have so many programs within their organization that aren't about selling you their insurance plan. They truly are about educating seniors and making sure that their quality of life is as good as it possibly can be given their circumstances. And so we're really excited to hear in a little bit about one of our other platinum sponsors, Arkansas Blue Cross and Blue Shield. Elite Home Health, we'll hopefully get to hear from Joe today. Joe is tied up in a meeting. I've actually been messaging with him this morning, and he's still getting pulled away. We all understand how that happens sometimes, but what I can tell you about Elite Home Health, another one of our platinum sponsors, is that they do skilled nursing. They have physical, occupational, and speech therapy services that go into the home and provide skilled nursing care as well to patients who may have just been discharged from the hospital following a surgery. They could also be patients who have maybe had a recent rehabilitation stay after a major surgery, and they're getting therapy to maintain that level that they built up to in rehab. Medicare covers home health services, and Medicare that covers home health services, other than the little teaser that Will Corcoran gave us earlier this morning, Medicare won't cover home care services. So home care services like Home Instead Senior Care are not skilled services. They are consistent respite in-home care services that aren't medically, they're not medical skilled services. And home health takes a licensed medical professional to provide home health. And it's so easy to get those two mixed up sometimes. Carrie, do you have any tricks to like help people kind of in their mind determine, okay, is this home health or is this home care? Because they're used interchangeably a lot. And it's just, I think, a lack of education on the public, really.
Yeah, one easy way to remember it is the skin is the plane that differentiates the two. So anything that enters the body would require a clinician or a specialist or a medical health professional. Everything outside the body can be assisted with by someone that's trained in those areas. And so that's really the difference between home health and home care.
Okay.
So your occupational therapists, your speech therapists, they really are working on those internal mechanics, right? So the speech therapists are helping with the physical activity of connecting the thought to the actual speech that's coming out. Occupational therapists, again, they're working on those functionalities, those capabilities. Physical therapist, most certainly you're thinking about motion, right?
Yeah.
So those are clinically trained individuals that focus on home health services. It's the same service you would receive in a hospital or a rehab center. Whereas home care, much like an extension of the family, they're going to do everything a family caregiver might do. And so those could be volunteer support services that provide home care like Faith in Action, professional services like a licensed private care agency like Home Instead Senior Care or the others. But that really is the difference between the two. And both work hand in hand. Both really do work in conjunction to help the individual that has needs age in the place where they wish to age. So great point that you bring up, and certainly valuable to our community.
Yeah, and I think too, at these events in person, a lot of times some of the common questions, and Debbie, maybe you could weigh in on this too, if you can hear me.
She's focused.
I know. Is, what's the difference between home care and home health, or what's the difference between assisted living and memory care and nursing home? And so I know in a little bit we'll have a good friend, Megan Cosgrove with the Meadows, that's going to be tuned in, and I would like to hear her take on it. And as a professional, I know the differences, but as just a person who has never worked in the field or who doesn't really understand all the different levels and what that looks like, I think that that's a really common question that a lot of providers get. And even more of a reason why we have events like this, is so we can educate and we can get the information about our specific services, but then also point them in the direction that maybe they should be taking. So yeah, looking forward to hearing from Megan in a little bit. And Trisha, I've been also messaging with one of our silver sponsors, Todd Watley, and he is knee deep in something in Oklahoma. So I was asked.
What is that he's knee deep in?
I didn't ask. Man, I'm really trying hard not to say a joke right now.
Woo! Go on, Sarah.
Hard. But I just wanted to reach out to you to see, okay, you don't only help and represent Adult Day NWA, but Senior Services NWA and Todd Watley PA are two areas that you know quite a bit about. So I could tell them about what Todd does, but I feel like they might be tired of hearing me talk.
I think you probably do a better job. I was just trying to remember the phone number because I have it in my bag here. So I have the work phone with me, but remembering the number. So yes, Todd Watley is an elder law attorney. He has been doing this for 20 plus years. One of only, I think there are now 4 certified elder law attorneys in the state of Arkansas. The last one to become a certified elder law attorney is actually participating in a coaching program that Todd is doing. Todd is now teaching other attorneys how to become elder law attorneys or how to improve their practices. That's a new thing. Anybody who knows Todd knows he's always doing different things. There's always another vision going on. We are in an office in Bentonville on 308 Southwest 24th Street. If you're familiar with Bentonville, it is very much close to Helping Hands and the DMV. That's my point of reference. If you know where the DMV is, you can find us there. He's generally in the office just on Mondays and maybe Tuesdays because, as Sarah mentioned, he has a practice in Oklahoma too, as well as some other things going in. So you can definitely catch him in the office on Mondays, but he is there to help you with all of your elder law things. He does not do any other kind of law practice. So people who are wanting estate plans, but his main thing is helping people who are going into long-term care if they are trying to apply for Medicaid. He's very knowledgeable about the Medicaid rules and can help you navigate that. Especially if you have some assets, he would like to help you keep those assets for your family members. That's what he does. So Todd would love to see you. I cannot remember the phone number right now, but I will put it on the Facebook page. Isn't that terrible when you answer
on my radio show notes?
So I'm so sorry about that. And hopefully Todd will never see this, so he won't know how lacking I am. But I will.
I don't know if I'm on or not.
I will post that. Oh, I can hear Cindy. I think I can smell hot dogs.
I'm sorry.
I can hear Cindy.
Can you hear me? I can't see me or anything. I'm so bad at this. So Angie's taking my phone. Oh, there we go.
We can hear you.
Okay. Hey. Hi. I've already had my hot dog.
Oh, we're so jealous.
Listen. Hey, we got it all. Look at all these bags. Can you see those? Yeah.
Oh.
Karen's killing flies.
Have y'all had anybody come through yet? Oh, it's paused. Man.
Did we lose her?
I don't know.
Hi. We've been driving, some residents come by.
Service. I think the service is
bad service.
Oh man. Can you hear us, Cindy? No. Well, shoot. Well, so we're trying to connect with Cindy Johnson. She is with Concordia Retirement Community. That's where you can get the hot dogs we've been talking about all morning. Making me hungry just thinking about it. And I'm sure she'll call back in a little bit and get some more information about Concordia Retirement Community. You know, you never really know how all of the technology is going to work out. And so we're just going to roll with it. I see a couple of faces popping up. Welcome to the very first ever in history Senior Virtual Expo 2020. It's like the only good thing about 2020 is what we're doing right now. But no, so we'll hear back.
I'm back.
Oh, there's Cindy.
Yes, I had to get closer to the building for Wi-Fi.
Gotcha.
Oh my gosh, you froze again.
Can you hear us okay?
It goes in and out. I'm walking towards the building and hopefully that will be better. So here's
good. There's Concordia. So that's what you need to look for whenever you're on your way to come get a hot dog, right?
Right. We just have a little drive-in right in our driveway. And I'll get in my office and maybe we can chat for a second.
Okay.
So how y'all doing?
We're doing good. We're doing good. We've had so many vendors and sponsors already weigh in and tell us about the organizations and just kind of keep people popping in and popping out. And I think you should be getting quite a few drive-bys because we've been plugging those like crazy.
We actually had Reardon Hall call and they said, oh, we miss everybody and we're going to send some people your way. So I thought, oh, that's so wonderful. Yeah.
Oh, that's awesome. And the true spirit of a good old Senior Expo.
Yeah. Not the same, but it's still good to connect.
It is definitely good to connect. So Cindy, tell us about Concordia Retirement Community.
Okay. So, Concordia is the big grown-up kid on the block because we've been around for 47 years and we have independent assisted. We do have a skilled nursing on site as well. We don't own it, but we still work with them closely. Luckily now we have been open to be able to tour and our dining room is open, not to the public, but oh my goodness, our residents were so happy when the dining room was open and they could socialize again. So activities are full bore. We can do visitations with family and friends at 2 of our visitation stations, 1 outdoor, 1 indoor. This is good news for connection and relationship and during this crazy time. Don't have a case. We're very proud of that. And we're kind of like the little mask nags, and mask patrols, but we get it done and it's we've made it through this time. So we can tour, can't give lunch out yet, but we always give somebody a little treat when they come to show them around. And I've got apartments and townhomes available and 1 apartment in my assisted living left.
Awesome. That's so thank y'all so much for being so
absolutely
and doing the hot dogs again. I mean,
oh yeah.
I don't even know how long y'all have been doing that, but it's definitely a staple in the event. And I've had more questions about hot dogs and door prizes than I have.
Yay. That's great. Tell them to come by. We'll stay open longer. We've got a lot and we're happy to give them out.
I will. Thank you so much. Do you have a door prize? Did y'all do a door prize?
You know what? Our door prize is our hot dogs.
Okay.
That's about how my week went because I was crazy busy. And so come by and get the hot dog. Yeah.
That's great. Well, Cindy, with Concordia Retirement Community, what is the best way to contact you if they want more information or need
Yes, give me a call. The main number here is 479-855-3714 and you can ask for Cindy or Lisa.
Awesome. And don't forget, drive by today and get
got my gloves on, ready to go. I'll have my mask on and we'll give you a hot dog.
Okay. Well, don't forget those gloves.
Okay.
Thank you so much, Cindy.
Bye-bye.
Bye. Next on my screen, I'm really excited to talk to Mr. Damon Wallace with Ox Insurance. How are you today? Oh, you got to unmute.
There we go.
Yeah, I
Is
know.
that better?
We're good.
Okay, well, I'm doing great. Hope everyone out there is doing good. Yeah, Ox Insurance is a new company that I started earlier this year before all the COVID stuff hit. And so we were just kind of getting our legs under us. Basically, I'll tell you a little bit about myself. Is I actually spent 21 years in healthcare before owning another business, which is actually auto repair. But last year decided to go ahead and get into the insurance business, basically connect a little bit more again on the health side. And so that's what I'm here basically to talk to today is about Medicare coming up. So we have the annual enrollment period getting ready to start. The great thing about that is that it's so confusing that you almost need help to find out what you're going to, the different plans that are out there. There's Medicare supplements, Medicare Advantage. You can stay with original Medicare. You can sign up for a prescription drug benefit. There's a lot of stuff out there. And really, unless someone's there to kind of help you through that, it can get very confusing very quickly.
Yes.
Yeah. And I will tell you, for us as agents, we have to do so much training on it, not only from the individual insurance companies, like Humana, Blue Cross Blue Shield, Aetna. We have to do all their training, but also we have to do training from the Centers for Medicare, from the government. And there are so many things you can't say, you can't do, and then there's so many things you have to say, you have to do. And there's so many options out there. I will tell you, it's so confusing that right now the insurance companies are actually still waiting on Medicare to finalize the rules for some of the products before they start in less than a month the annual enrollment period, and they're still waiting on the Centers for Medicare to finish up some final rules. So all that to say is that there's, what's that?
Election.
No, it may be. So annual enrollment period starts on October the 15th. You'll probably start seeing some things flooding your inbox, some advertisements on TV that will start on October 1st. That's the earliest that anyone can start promoting it. They can't sign you up. You can't change plans right now. If you're already on a Medicare plan, you cannot change until October 15th. That's the earliest. It runs through December 7th. So you've only got about a month and a half to determine this. This is when all the agents that are selling Medicare, which not all insurance agents get into the health side of it, but it'll be very important for you to get with your agent. I'll be glad to help you as much as I can to find the plan that's going to work for you. A lot of zero deductible plans out there. Some of them, I know Blue Cross Blue Shield and Humana are both even doing acupuncture now, where they will cover that and some over-the-counter drugs on your Medicare. Some of the plans will actually even give you a $50 gift card just for going and visiting with your doctor once a year for a wellness visit. So a lot of exciting things like that coming down the line.
Awesome. And let's see. Where is your office located?
I actually work out at my shop at Gravett. But because insurance, number one, with all the COVID stuff going on, they've actually, a lot of it's Zoom meetings just like this. One of the things that's been good about this is that it pushed the government into saying, hey, we can get electronic signatures now. We can actually do voice calls and voice approvals. You don't have to actually sit down with someone. You can do it all online now, which has really been a long time coming. So you can do it from anywhere. Basically, we're going to meet you at your kitchen table, but we don't even have to come into your house.
Yeah. I know, it's amazing with what technology can do these days. Now, did you get a door prize?
No, unfortunately, because insurance is so government regulated, they allow, yeah, it's so, matter of fact, you can't give anything over $15 and it can't be a gift card. So yeah, it's very, very controlled as far as that goes, but we'll be happy to meet with you and maybe buy you a soda.
Awesome. Or you could just direct them to Concordia for a free hot dog.
Exactly.
Oh my goodness. Well, Damon, thank you so much. And what is the best way for someone to get a hold of you if they need more information?
The best way is actually through our website. It's oxinsurance.net. You can also call, it's 479-657-5553.
Got it. Well, Damon Wallace, thank you so much for being involved in this Senior Virtual Expo. And we really appreciate the information.
You're welcome.
Hey, we've got one of my good old buddies up next. Her name is Megan Cosgrove. She is with the Meadows Independent and Assisted Living Facility. And before you start talking, I just have to say, I'm pretty sure Diane Bufford thought I was about to say her name, and she's a good old buddy too. I saw your face light up, and I'm like, I'm about to talk to Megan. That's funny. It was funny on my end, y'all. I'm laughing. Okay, I'll talk to you next time. What's up, Megan?
Hi, hello. Thanks for having me.
We're doing good.
Good. Yeah, great. It's good to see these faces and to like do this even though it's not in person. So this is good.
Yeah. So Megan is with the Meadows Independent and Assisted Living in the heart of Bentonville. And one of the coolest things, in my opinion, about the Meadows is that it's family owned and operated. It was a vision that her grandparents had many moons ago that actually came to fruition. They made it happen. And now Megan and her mom get to carry out her grandparents' legacy by, in my opinion, continuing to hold the torch. And it's so cool because you see so many corporate chains and red tape that you have to jump through hoops for a lot of times when there's, special specific needs for these residents. And you don't have to do any of that, do you? You don't have to
Not
go
usually
tape or anything, right?
Not usually. We're pretty good on that end. So yeah, it is. It's really nice. We have direct conversations, with the residents every day and with the family members, so they know if there's an issue or concern, they come directly to us and they can just work with us on that. And so that definitely is how he wanted that to be. And my grandfather really wanted this to be a very grassroots thing, and that is what it is. So we're very involved in all of our, not only the residents, but then also our family members' lives and what's happening and building those relationships. That's something that's very important to us. So.
Yeah. And how long have y'all been serving the community? I know it's over a decade. Like, is it 13?
Yeah, 13 years. Yes. Yeah, look at you. Impressive.
Well, the only way I was thinking that is because I've been with this program for a little over 4 years. And I remember the Cardinal fundraiser that y'all had for us was your 10th anniversary. And that was like right in the beginning. And so
yes,
that's how I figured it out.
Very good. That's right.
That's what happens when you're working and you're trying to do a live expo, a live virtual expo.
Yeah.
I remember to turn my cell phone ringer off, but not my office ringer. We're good.
I'd say you're doing quite well at multitasking, so it's fine. You just keep doing what you're doing. Okay. Yes, you're absolutely correct. And we've always been big fans of Adult Day, NWA, regardless of the name or anything like that. So yeah, we need to do another something or other once. Well, we are here soon.
We are.
But we'll get to that. Mm-hmm.
Yeah, we'll get to that.
Yeah.
Yeah, let's talk about that after we finish talking about the Meadows.
Okay, let's talk about the Meadows. So we are a level 2 assisted living. We have a lot of folks who are still very independent. They still function. There you go. You've got your prop ready. I wish I might find a picture. Yes, you just keep doing what you're doing. Trish, I appreciate that. So we have a lot of folks who still function very independently here at the Meadows. I am happy to say we have not had one COVID case in either our staff or in our residents.
Yay!
So that's been a big deal. Now we are fully aware. Yes, thank you. Now we know that could change at any time, so we don't say that flippantly. But we definitely are so thankful. We have said all along we have the most amazing staff that care and that consider this their family as well. And this really has proven that point, that they both in their time here while they're working, and then also when they're not in the building, they are mindful of where they are, what they're doing, that kind of thing. So it is shown up in our day-to-day lives, and then also in our staff.
Yeah.
So that being said, we've been able to carry out with visitation. Yeah, we've been doing that since July 1. And so our folks function independently up until those who need more assistance. We do have nursing staff here 24 hours a day, and they are able to move amongst themselves in the building. We have obviously a lot of guidelines and restrictions in place due to the COVID-19 stuff. But as far as abilities and our level 2 licensing, we have a wide range of abilities. Yeah, that's kind of us in a nutshell. You know, we're used to going and doing and kind of thinking outside the box as far as activities and stuff like that. So we've just thought outside the box in a lot of different ways here in the building. We're not going and doing, but we're still doing, just differently. So
you guys have any openings, and are you taking new residents right now?
We do, and we are cautiously. Of course, there's all kinds of guidelines and parameters and that kind of thing. We're not doing full tours, but we are doing modified. You know, probably kind of the same story as everyone. We are meeting with folks outside of the building and in different ways. We're starting to open up a little bit more and get some new folks in. And we're starting to see folks a little bit more willing. But it's a scary thing. I think the thing I can say is that, you know, there are a lot of folks who are concerned about coming because they're worried that this is just like a germ pool. Everyone here is, you know, so bad. You know, man, these folks, all of them are concerned about each other, and so they are watching out for one another, and as well as the staff. So everything is cleaned continuously. They're all very cautious and open. So, you know, I think there are a lot more precautions than people realize in place.
Oh,
not just here, but everywhere.
For sure. And you have to be.
Yeah.
If you weren't, then you would have it in every room, in every hall.
Right. Yeah. Yep.
Give us contact information, and then let's talk about the other thing.
Yes. Okay. So the Meadows, we are located at 2300 Southeast 28th Street in Bentonville. Preference is you don't just show up, but you can call us at 479-273-9969. Our website is www.themeadowsinbentonville. So that's themeadowsinbentonville.com. And then Megan, my name is Megan Cosgrove. And that pretty much sums it up. My mom is here as well. We are a family business, as Sarah mentioned. So, you know, we're around and available.
Awesome. Okay, really quick, we need to talk about the organization Socket to Alzheimer's.
Yes, we do. This is necessary. There you go. Model on.
I've got one. Hold on. Can you?
Yes. Way to go, ladies.
You
got it.
It's like QVC.
Hold on.
It is.
Here's another.
I love it. Woo!
Socket.
Perfect.
Whee!
Yes. Yes, I love it.
How is that flexible? Okay, Socket to Alzheimer's is a local nonprofit organization developed and operated by Mark Linkus in honor of his wife, Anne, who was diagnosed with this devastating disease. And he's made it his mission to bring awareness and raise funds to help support caregivers, and to really bring into the conversation and to work into, any aspect of business or whatever. Caregiving and is extremely stressful. It's a daunting task, and he is by far the most positive, loving caregiver that, sets like a top-notch example. And the way that he and the Socket to Alzheimer's organization bring this issue to the forefront is by their socks that you just saw. So they designed and made, I think there's 7 styles of these socks. Right here. These socks that they sell, and a portion of, or actually they give you as just a kind of thank you for a donation, but typically a suggested donation for a pair of these Socket to Alzheimer's socks is $15, but if you want to give more, it's certainly going to a good place. They have supported our organization for a very long time, and one of the big fundraisers that they have coming up is called the Clothesline Campaign. And Megan could probably speak to that a whole lot more sophisticated. She can talk about it a lot better than I can.
Well, we'll see. Okay, so I don't know how this is going to work because I can't see Zoom, but can you see this? Can you see
Yes.
this? Okay. So this, we hope, our goal is that you'll see this little like clothesline with socks and crazy colors of paint hanging around Northwest Arkansas in approximately 2 weeks. Okay, so the goal is here. I'm going to put it back up just one more time. I'll leave it there. You don't need to see me anyway. So our goal is for you to see this hanging around. The deal is that we have people who will refer their loved one, and not loved ones, friends, family, businesses, to be the next recipient of these clotheslines. And when they receive this clothesline, it'll hang in their lawn for roughly 2 days. While it's hanging there, we ask that they raise funds, that they sell socks, that kind of thing. It is all volunteer. We're not going to pressure anyone. Nothing will happen if you don't do this or you don't participate. We're just hoping that they jump in and do it. And we already have some amazing sponsors. Springwoods is on board and has sponsored. Good Shepherd is sponsoring. Granbrook has sponsored as well. And I think I'm missing someone. I'll think of it here in a minute. And so all of these people have come together and said, hey, this is still really important. Last year we held the sock hop and it was super fun. We had a great time. We were really excited about doing it again this year. And obviously our plans have changed. So our goal is to continue getting the word out. You'll see this ostentatious clothesline hanging out. And we'll hopefully continue to spread the word. While we're spreading the word, we'll continue to do some fundraising. And then ultimately, those funds will go back to the community. Everything that Socket to Alzheimer's donates to stays local. And right now, with everything going on, the main focus is Adult Day NWA. So we are super excited about partnering with you, Sarah. And having a lot of fun with this. Like, this is going to be super fun. We hope that people kind of get into it and they send it to their friends, and people like love and hate it. They're like, oh, that's ugly, but it's kind of fun that it's here. So that's the goal anyway.
We are just honored to be, included, and love Mark and Ann so much. If you've ever met one of them, you can't help but just fall in love with them, and just really touched to be able to be working with them and alongside them. And Mark has even asked that we start selling socks out of our program facility, because it's really hard for him as the primary caregiver of Ann to get out, sell socks. And I said, absolutely. So if you want, if you're interested in helping support that organization, but not quite ready to put a clothesline in your yard, that's okay. I can hook you up with some socks too. So Megan, what's the best way to get a hold of you? Did we already do your contact info?
Yes. Yeah, but let me give it again, because you can get a hold of me and I'll pass it on. So it can be for Meadows or for the clothesline campaign. There are several others working on this campaign as well. Sharon Ledbetter, who I see on this
I'm here.
There's Sharon.
I'm here.
Sharon has been a huge help. They've been like a big part of the driving force, and I'm just gonna say that give them some spray paint, and that Springwoods crew, watch out. It's happening. Things are happening.
It's so hideous. It's hideous.
I didn't say what was happening, Sharon. I just said things are happening. So yeah, so they've been a huge help in this as well. So if you want to reach out to Sharon, reach out to me at the Meadows. Lighthouse Group, Allison with Lighthouse Group is another sponsor. You can reach out to any of us, but my number here at the Meadows, or to just get more information or to talk to one of us, is 479-273-9969. Sharon, did I miss anything? Was there anything on that clothesline campaign that we need to throw out right now just as a teaser?
No, we just need everyone to sign up for some dirty laundry and get this placed at their business.
Right. It's happening. It's happening. And don't worry, for you healthcare providers, it is coming soon. We're going to get it first, and you're going to hear about this soon. You're going to get the information, and it's going to hit you before you even know it.
Oh, snap. We're
maybe we can do a parade at the end of this campaign.
I like it.
That'd be fun. That must. Okay, thank you so much, Megan Cosgrove. Oh, door prize. Hey, it says hey FR. Hi, friend.
Hey, friends. It's a door. Here, hold on. Here.
I need that.
That's cute. That's cute. If you would like to register for that door prize or any of the fabulous door prizes that we have shared with you today, you have until next Thursday to get your registration in. The only way that you're going to be eligible to win a door prize is if you send an email to this address right here, seniorexpo.services@gmail.com. All we need is your name and phone number, and then the winners will be announced next Thursday.
And we've actually already had people emailing. I've been checking the email address, just a few, but we've had some people emailing. So
that's great. That's great. Okay, thank you, Megan. I understand that Miss Brandy Schneider has a 12:30.
Hello, I do.
Can't believe you're actually working today.
I know, every day, darn it, I know.
I know, and I already told Diane that I would talk to her next, but Diane, this is funny to me because your faces on my screen are right next to each other, and I still see you in my head. So it's like, these two do go together.
We still go together. In fact, Diane's going to do a presentation for us at the Community Center Monday. So it will be back to the Diane and Brandy show for a little while on Mondays. So we're excited to work together, even though I miss her at meeting.
I know. Well, so Brandy Schneider, she is a licensed social worker at the Schmeeding Center in Springdale. I don't know why I almost said Fayetteville. And they provide so many critical resources to our community. And I know that we don't have enough time to go through every single thing that y'all do, but what are some of maybe the high points that when you're at an expo that you have questions about or want to make sure that you give information to the attendees for?
Yeah, so I really like to stress our family caregiver services. So we probably spend 90% of our time working with family caregivers, and that primarily means family caregivers of people with dementia. So we provide individualized support and education for caregivers. So what does that look like? Well, that means as soon as you are taking care of someone and they have a diagnosis, we want you to call the Schmeeding Center, because we want to be able to connect you with all of these other wonderful resources that you're learning about today and make sure that we have a plan in place for you. Being a caregiver is incredibly hard, the hardest job you will ever do. And too many people just sort of feel like they have to do it all alone because they don't know what resources are out there or what steps they need to take. So the Schmeeding Center is here to help guide you through that process, be your support. I answer my phone pretty much 24 hours a day, 7 days a week. So even if there is an issue on the weekend, we know crises do not happen 8 to 5, Monday through Friday. So if something happens after hours, then you can pick up the phone and we can talk you through those issues that are going on as well. And we also offer a bunch of different support groups. I think we offer about 12 different support groups, and we still have about 7 of those right now that are happening online. So those are all caregiver support groups that you can tap into and get to meet and get to know other caregivers who are going through similar experiences. And then we're still continuing to do a lot of our educational programs. So we do a variety of educational programs, not just on caregiving, but on healthy aging topics as well. And sort of the new initiative we're really excited about working on. So a lot of people don't realize that our clinical partners are Washington Regional Senior Health Clinic. So they have a senior health clinic in our building at the Schmeeding Center where they have geriatricians, a neuropsychologist, and also their movement disorder specialist. And we have been working collaboratively with their memory disorder clinic to develop a healthy brain and wellness initiative. So the goal is really about how do we reduce the risk of someone getting dementia?
Yeah.
We know that once someone has dementia, there's not a cure for that. And the key to a cure is really prevention or risk reduction to begin with. And we now know that there are so many modifiable risk factors that contribute to dementia later in life. So we are really trying to sort of amp up our educational programs about brain health and wellness, as well as services to address some of those things. So
I have a question. I saw an article, I think it was on the Today Show, and they were talking about I think it was a Mediterranean style diet. Is that something that you guys are promoting or?
Yes. So Mediterranean diet is a very healthy diet for brain health. We talk a lot about the MIND diet, MIND. So that's a cross between the Mediterranean diet and the DASH diet. And the DASH diet is a low sodium diet. So lots of green leafy vegetables, lean meats, eliminating those things that we know we shouldn't have, like the processed foods and the fried foods, eliminating things like cheese, or at least significantly reducing those things that have, I know the cheese is always hard. I always hate to say that, but the good news is you can still have 1 glass of wine every night with the MIND diet, and that's good and healthy.
Just one?
Just one, yeah. Just one. And no, it does not work. If one's healthy, 2 are healthier. That's not the way it works. But
how big the glass could be. So.
Exactly. Yes. Yeah. I'll let you look that up later, so I don't ruin your fun today. Yeah. So dark chocolate is good and healthy for us, but mainly sticking to those plant-based diet is what is really healthy for your brain. So eating a lot more fruits and vegetables, and the green leafy vegetables especially.
Awesome. Now, tell me what physicians are operating in the medical clinic side over there right now?
So we have Dr. Randy Shin, Dr. Teresa Shin, Dr. Nepomuceno, and then Dr. Gemmel, our neuropsychologist, and Dr. Diamond also has a clinic. He is over there 1 day a week, typically. Right now, Right now, that's a little bit different. We also have Antoinette Hartman, who is an APRN, who works over there as well with Dr. Shin. So she's there every day, and then everyone else is kind of rotating through. They're not really seeing in-person people over there right now. Most of those visits are telehealth. Same with our individualized services. We're doing Zoom and phone. We're not really meeting with anyone in person, but certainly we are seeing a lot of people on Zoom.
Oh, I'm sure. I'm sure. Well, did you get a door prize?
I did, but so I'm not in the office today, and my door prize is in the office. So I'll tell you what it is. In keeping with our brain health and wellness theme, we have a Fitbit, an electronic scale, a glucometer, and a blood pressure cuff.
Wow, that's awesome.
And that is, and I want to make sure we point out one of the initiatives that we also do. Most people don't realize that we are one of 7 centers on aging in the state of Arkansas. So technically we are under the UAMS umbrella. And so we are one of 7. And one of the initiatives that all of the centers on aging have right now is opioid prevention in older adults. So all of those door prizes that we're able to give out actually came from an opioid OPAL grant for that opioid prevention.
Very nice. Well, that's a really nice door prize. Thank you so much.
Yeah, you're welcome. Thank you.
Yeah. Is there anything else you want to share with the attendees or that you think is important that we maybe skipped over?
I just, would invite them to visit the Schmeating Center website, schmeatingcenter.org. Just check for our educational programs, because even though we're not doing them in person, we still are doing a lot on Facebook Live and Zoom. So we don't want to miss connecting with anybody who might need the information or who might need our help.
Not at all. Well, thank you, Brandy. And I know Lauren at the Schmeating Center works alongside you, and you guys just do a wonderful job and feel a much needed service in our community for the senior.
Thank you.
Brandy Schneider.
Yeah. Oh, I was going to point out too that all of those things we do for family members are free. So no one has to pay us to come in and have our services.
But wait, there's more.
Yeah, there's more. I always forget that free part, but yeah, that's an important part to point out, that no one gets charged for any of our services.
That's so awesome. Okay, Brandy Schneider with the Schmeating Center under the UAMS umbrella. Thank you so much for participating today and for your involvement. It's always so nice to see you. And Miss Diane Bufford, you have been waiting so patiently. Thank you. I really appreciate it, because I can just come up with a few thoughts in your head, like, is she ever going to come over here and talk to me?
Can you hear me? Can you hear me?
I can.
Good, because I'm not the Zoom expert. So Brandy and I are going to practice a little bit. So I wanted to make sure that I'm on. Yes.
Fine. So Diane Bufford comes to us with the Attorney General Leslie Rutledge office. Her office is in Lowell, right?
Correct.
So we're really excited to hear about what services the office you're located in does to help prevent scams and to keep us all informed about how not to be the next victim, and what's really important for us to know coming from the Attorney General.
Correct. A lot of people don't know that, and what I'm participating in, or my position is, it's in the consumer protection area, and a lot of times we get at the phone. I just had to put it on mute because I'm getting calls, but main thing, and especially I really focus on senior adults because that's been my background, and we have so many that are preyed upon being scammed, and a lot of it has to do with phone calls. A lot of it has to do with mail they're getting. Right now, the Publishers Clearinghouses, they're putting, they're talking about you're going to win, and people are getting these phone calls that said you've won, but by the way, you need to pay us the taxes. Yeah. A lot of people will do that, and even though none of those places will ask you for money, but they will get scammed, and it's really a sad situation. So what we try to do is keep our seniors and keep our folks informed, and the families, because hopefully I bet you have family members here listening in, but so the family members can protect these seniors, because they really do. They get scammed out of things, and some of it's extremely sad situations. So that's a lot of what we do. We get emails on all sorts of things. Of course, we do have, we have a hotline for Medicaid. We have a Medicaid unit that takes care, it handles those types of issues. Medicaid fraud. We have a Medicaid fraud unit. A lot of people do not know about that we forward people on. We get calls on anything. It's just amazing. And with COVID-19, the scammers seem to be out in full force. I think you probably already heard about unemployment fraud. I bet we've received hundreds and hundreds and hundreds of people that have received false unemployment claims. And so we've been handling those issues. But like I said, mostly with, because we're talking about senior adults, mostly we just want to deal with how to protect them from being scammed and how to protect them from any elder abuse, any of that. And I like the initiative that Brandy was talking about, because I think if you look at our the ad that I put, we sent in to you, it has to do with the protection, the drug, drug protection, and how to keep people from being, it's a really huge issue. So we've got so many of those things. A lot of people don't know, and I'll just say this, our website is just a wealth of information. Yes, a wealth of information. So we really do provide a lot of information on those sorts of issues.
Mm-hmm. Now, have you guys had a lot of complaints about seeing vaccinations or saying, hey, we've got a magic treatment that'll cure COVID? Have y'all come across?
Yes, we do. In fact, I think the Attorney General actually, we had to file a lawsuit against someone because they were putting out information that said that they had the magic pill, and no one has that magic pill yet. I mean, and we get that information. We're getting a lot of calls about, I'm not getting my unemployment, but yeah, that's what we do get a lot of calls about from people that say, was this work or is that work? And we really have to forward that on. A lot of times people don't understand that the Attorney General does not have oversights of DHS or the Department of Health and Human Services. We don't have oversight, but we can certainly provide. That's one good thing. We can know the resources. We're kind of similar to the Smitty Center like that. We know the resources to give to people to protect them, and how to look out for it. Yeah.
Yeah. So if someone has received a text message that says, I've attempted to deliver your package, and if you don't respond in the next 30 minutes, you're not going to get the package you paid for. And it scares you because you are waiting for a package. But I mean, what should they do?
And I'm glad they do call us, because if they say you're going to, we're going to deliver a package, and if you didn't order that package, don't deal with that package and send it back to you. You can call the post office. The post office will take care of things like that. That if it's an unwanted package or a package you didn't call for, and I guess that brings me to one thing that's a really huge call and thing. But the package issue has come up a lot, where people send packages. People get checks in the mail saying, I sent a check, so if you deposit this, you can get such and such and so and so. Well, they're fraudulent checks, or people, a lot of people are getting calls on services like from online services that, yeah, you just signed up for that and you owe us for this. Well, you can follow, if they've taken money out of your account, if they figured out how to get money out of you. Obviously, we handle with the identity theft programs. There's a lot of that. We can help them through that. Number one, we tell people to always call and report it to the police. If you get these fraudulent scams and emails, we tell them, please call us, because we keep up with that. We do have files on all of those, how many calls we get on certain things. But the Federal Trade Commission looks into it, and you can always report a complaint to ftc.gov. That's really important. They have wonderful information too. And the one I've failed to mention is the Social Security scam. People get calls and say, your Social Security card has been compromised. It's been associated with fraudulent activity, and you need to send us money so that but don't tell anybody, because you need to send us money. And a lot of times the big thing about scammers is how they want you to send it. They want you to buy, and I've seen people do this, and this just amazes me, gift cards. Go to Walmart, go to Target, and buy a $500 gift card, and then come home and tell me the numbers off the back of it, and we can use it. And it's happened to so many people, yes. And that's when you know it's just scary.
It's still happening, but it is still happening. I pulled
it
up.
happens to so many people. Well, and right now too, there's desperate times. People are really desperate, the economy, a lot of people are struggling. So if they get these messages, they thinking, oh, well, hey, I can, get help. That's another one too. I mean, you can go on grants. They'll say, oh, we've got some money for you. So send in, if you pay me $1,000, you'll get a grant for $250,000. That's happened to a lot of older people too. They send out there, so it's a scary world out there, but what we try to do is protect them, tell them how to process it. And we do have identity theft packets that we send out to people, what happens when you do have that stolen from you and such. So we do all of that.
And the other handouts that you guys usually have on your tables at these type of events when they're in person, they're not just about scams. They have all kinds of resources that you don't even think you need until you see it and how handy they make it. I'm talking about the File of Life. I think
File of Life is the best thing that was ever put out. Yeah, it's wonderful, and wish we could hand them out to everybody. Well, I guess I can have those, and you can send them out to folks that you want to know, or all these people that are helping with this event. I'd love for you to come by and pick them up, because you put it on the refrigerator, and you got a second? I'll go run get one. Let me get one real quick.
Yeah. They're so handy to have stick on your fridge or on the back of your door. Right there it is.
Here it is. Now put it on your refrigerator. It has a magnet. Remind me about this. And then here you put all your emergency contacts. I don't know if you can see it. And your medical data and your medical conditions. So if you have to call emergency services, it's all right there on your fridge, or right there where you've got it, so people can get to it quickly. And they're great. They're great to have. They're free. We give them out to folks. You're right. It's really good, really good. We do have wonderful handouts, and you can still get those from us. We can mail them to you if people want to. You can actually go online and request them. So I hate that I can't get out and send these things to people. So yeah, we do have a lot of good materials.
Speaking of good handouts, did you get a door prize?
No, we don't have, unfortunately. We don't have budgets for such things. Yeah.
Several vendors and sponsors who have gotten more than one, so you're covered.
Yeah, I wish we could. Yeah, I think next time we do this, I'll just, yeah, well, we'll figure out something next time. But no, unfortunately, we don't have budgets for that. Yes.
You can put together a little box of all your handouts.
I could do, absolutely, absolutely. I can do that.
Yeah.
I can do that, absolutely.
All right, Diane Bufford with the Attorney General's of Leslie Rutledge's office out of Lowell, right here in our community, is solely focused on helping prevent seniors and the public, of course, fall victim to scams and so many other concerns that are going on in society right now that really are scary when you start talking about it like we have today. Is there anything else you want to give them contact info if they have any questions?
Yeah, if you're more than welcome, because a lot of us are working off site, but I work in the office, and so I'm the one that, in fact, I get calls all over the state that say, "Oh, you actually answer the phone." So yes, I'm here and I answer the phone. So I'm more than happy if you want to call me, leave it. And if I'm not, I don't work all day long, but I answer the phone 4 to 5 hours a day. So my direct line is, and anyone is welcome to call me, 479-306-7171. And you're more than welcome to call me and see if I can help you out. I'll be more than happy to.
Well, Diane, thank you so much for participating in this event. And even if it's not in person, it's always a pleasure to see you. And I look forward
to see all of you. Yes.
Soon.
Okay. Bye.
Bye. Okay. One of my favorite people just popped up on my screen. His name is Mark Blinkus. Mark, you want to push the unmute button and talk to me?
There you go.
Did I go? Did that get it?
There you are. There you are. Hey, well, Mark.
Hello, gang. How are you?
Good. How are you?
Oh, I'm fine. You know what?
What?
I like Trisha's logo behind her better than yours.
You just missed our big plug for, look. Hold on. I gotta.
No, Sarah.
Now, what are you going to say?
Is that Ann?
How about that? Yes.
Oh, come on.
I'm going to see her sock.
Hold on. Well, look, let's talk about, I'll work on getting it untied.
I have mine on also.
I bet you do. For those of you who are tuned in right now wondering what on earth is going on, I was trying to show our friend Mark Blinkus my socks, and he knows why, because they're very special socks. So, Mark, would you like to talk about your organization?
Yes, our organization is Socket to Alzheimer's. It's a 501c3 foundation, which I started to support those on the Alzheimer's journey and the caregivers who are taking care of them. The reason I started this foundation is I lost my mom to Alzheimer's in 2001, and then my wife Ann was diagnosed with Alzheimer's in 2014, and so she decided to go public, and we are doing everything we can to try to raise funds to benefit those who are in the same journey we're making, or those who, the caregivers, for caregiver training. And of course, one of our favorites to support is Adult Day, Northwest Arkansas. We have a real heart for Adult Day, Northwest Arkansas, for Sarah and Tricia and their organization.
Oh, thank you so much, Mark. We love talking to you and working alongside you. And Megan was on earlier talking about the meadows, of course. And then when she was finished with that, we started talking about the clothesline campaign and gave some teasers about that and broke out some socks and started talking about you and Ann and your organization and how important it is and just how truly I just love your story. And while it's heartbreaking, it's also incredibly courageous and important and helpful for so many. So how long have you and Ann been married?
66 years.
Yay!
I think it will be a permanent arrangement.
You think she's going to keep you?
Yeah, I think so.
I think she should. I think she should.
I don't think she has a choice now.
Oh goodness. Well, so Sock It to Alzheimer's does help support local Alzheimer oriented and caregiver focused organizations, but it's not just in Northwest Arkansas that Sock It to Alzheimer's has a presence. So Mark, do you want to talk about just for a minute the presence that your organization has in other parts of the country?
Well, we have a large footprint in the St. Louis area. Our daughter Brenda heads the area in St. Louis, and of course she does a much better job of fundraising there than I do here, fortunately. And but we actually support 5, and I'm sure it doesn't matter for me to name them, but our foundation we have 5 different organizations approved. They're all out there with boots on the ground, trying to do for those with Alzheimer's. Now, those we support are Delta Day Northwest Arkansas, the Brawls Foundation, the Smittings Center, the Alzheimer's Association, and Alzheimer's Arkansas. We support those 5, and here, and of course, the Alzheimer's Association chapter in St. Charles, Missouri.
Mm-hmm.
That's where the money goes, and I like to always remind everyone that we have no salaries. We pay our own expenses when we travel. If we go to Little Rock or St. Louis or wherever, we pay our own expenses. I get such nice birthday gifts as a wagon to move socks in when we go to a show, and we're very frugal, and anyone who donates or supports our organization can rest assured that every penny goes to help someone on this devastating journey, or those who are caring for them.
Right. That's just, I just love what you guys do. And we are just so touched that we're included in that group of organizations to be supported by Sock It to Alzheimer's. And I'm always super happy to put these bad boys out.
Finally got to them. How about that?
I finally got it untied.
We just have to get you some, maybe we can take up a collection and get some shoes that don't cover them.
I know. And I will say too, my oldest son, Will, he's 12. He loves wearing bright colored fun socks, and it doesn't faze him a bit to strap on a pair. I've got, I think, every style that come up on your calves for him. He loves sporting his Sock It to Alzheimer's socks, and has actually had some pretty sweet conversations with some of his friends and even a teacher at his new school that I'm pretty confident would not have happened had it not been for those socks, because you don't you don't want to talk about having Alzheimer's or being a caregiver to someone who has Alzheimer's, because it's not a very fun thing to go through or talk about. And when you see that somebody else knows what that is and is actually wearing it on their socks, it's like, you got to ask about it. And you're just more likely, I think, to ask about it if you know firsthand what that's like. And so
Sarah,
it's really interesting.
excuse me. You bring up a real good point. I did not mention the significance of creating awareness, and that was one of our primary purposes. You know, we felt like when we started the foundation and with the socks that you know, if we could create enough awareness, then the money would come.
Right.
And I have always really enjoyed being in a restaurant back when Ann and I were able to do so. And people across the aisle, I'd notice every once in a while they look at my socks, and I would naturally have my pants leg up just a little higher than usual.
I figured you would.
Yeah. And sooner or later, not every time, not most of the time, but sooner or later they would get up enough courage to ask me about the socks. So that was a very important part of it. And you know, there's so many resources. One thing that Ed and I really work toward is also trying to help recommend people, whether in our church, and we've been able to recommend, you know, try to get them in the right place. You know, do they need to go talk to Brandy, or where do they need to get the help? Do they need to get it from Alzheimer's Association or from Betsy Broyles, or where? And do they need help at your at Northwest Arkansas? But there's so many resources here in Northwest Arkansas, and we're so blessed to have them. But it amazes me that so few people actually take advantage of them. And that's one thing that we're trying to do, is to get people, and we have been successful in getting several people headed in the right direction. And with all of the things we do, just like what you're doing today, you would think that everyone in Northwest Arkansas would know about what you do.
Yeah.
But they don't. And you'd think that everyone would know what's available, you know, it's a Smitting Center, but they don't. And so these are areas that we help. It's not just money, but we enjoy, and we have been able to put several even within our church, help them to see the people they need to talk with.
Well, that's so important, and that rings so true and goes right along with what our purpose is here today in doing this event, is to get the information to the people who need it the most. I mean, we know, because we're in it every day. We know if somebody comes across our desk or walks into our lives that is a caregiver and they need help and they're exhausted and they need a break, we know who to send them to. We know what resources are out there. But if we just keep it all for ourselves, it's not really going to help that many people, because not everybody crosses paths with me or with you. And so we've got to really be diligent at getting the information out, sharing all the resources that our community has. And I love that Socket to Alzheimer's found a fun, creative, and effective way to start these difficult conversations and to raise awareness about such an important and prevalent issue that we don't want to talk about all the time, you know?
Well, another reason that we're so supportive of you and what you do there is the fact that you're not really an option, you're a destination. I mean, if someone has that particular need, then you're the place where they will get the help they need. And it's not a matter of making choices between 4 or 5 different locations because they're not available. What you do is extremely important, and you're centrally located now, and there's no reason why. Of course, I know you're limited with the number of people you can accommodate during this COVID-19, but one of these days you'll be able to have capacity there again, full capacity.
Well, we are certainly looking forward to that day. And when Megan and I were talking earlier about the clothesline campaign and the fact that we are, our program is the home for selling socks out of right now. And if they want socks, they can reach out to me. But what other information, or maybe what's a good way to contact you, Mark, if someone wants more information about Sock It to Alzheimer's?
Well, there are actually two ways. I would say the best is probably go to our website, sockittoalzheimers.us, and they will find the information they need there. And anyone can feel free to call me at any time. I'll give you my cell number, which is what's on our calling cards. It's area code 479-616-0445. And I'll be delighted to try to assist anyone that, who needs help, or anyone who needs socks. But you can order online. You can donate on our website.
Awesome. Well, Mark, please give.
And also, we're not selling socks. We take donations and reward your donation with socks.
Yes, I clarified that earlier. For a suggested donation of $15 or more, we'd be happy to gift you with a pair of nice socks.
We might even give them two for $50.
Is that that's right, or two for 50? Is that Ben laughing in the background?
Yes.
I love that. Well, please pass on all of our love and best wishes to her and to you. And thank you so much for everything that you do to help support our program and for sharing your message about your challenge and your journey through this kind of difficult time. But I really do think that you make, if anybody can make it look graceful and still loving without just losing their cool, you are the kindest man and best caregiver I've ever seen firsthand examples of. So you're a very special person.
Well, I don't know. I know it's a tough journey. It's tough for both of us, but and I think the difficult part is she and I both know that it won't get any better, but we have strong faith and hope, and we'll just keep on doing what we're doing as long as we can.
We know.
I appreciate what you do, Sarah, and appreciate Tricia. You guys keep up the good work.
Well, thank you, Mark. It was a pleasure visiting with you, and we'll see you hopefully in person really soon.
Well, I hope so too.
Okay.
Bye-bye. Have a good afternoon.
You too. I see Jen Edwards back with us. Hey, Jen.
Yes, I've been in and out, and I just wanted to say hi, Mark, and just
hi, Jen.
I second all that Sarah was saying. Yes, you are an amazing man, and what you do is just unbelievable. So yes, I just wanted to pop in and say hi and say that. So and Susan's back in too. So she.
Bye-bye.
Thank you.
Susan, have you been listening today?
A little bit in and out too.
Yeah. What do you think so far?
Yeah, you all do a wonderful job, and I know it's really tough for caregivers and family members because, as Mark said, it doesn't get better, but you have to maintain good, strong faith and know that God is with us, and He will help you through.
That is so true. That is so true. Well, you're definitely in good hands there at House of Three with Jen and even Shane sometimes, you know.
Sometimes. Thanks.
If he's not there, he can't defend himself. So
That's right. That's right. Thanks,
is.
guys.
Thank you
you.
so much.
They said you hello.
Who said that?
Hi, Ann. Can she hear us?
I think I muted them. I'm sorry.
Okay, no, that's fine. Wow. Okay, so
Have a few, just a little while left till this event is over, and I know I've been getting texts from people who wanted to join us, and then work came up. As you know, it's a work day for everybody. So,
yeah.
And just a reminder about the website that is active now, still doing a little bit more work on it, is seniorexpo.services. So www.seniorexpo.services. That's what it is. And that will be up for a whole year, and we'll be modifying it as we go too and adding more information, but we're hoping that's a resource because we have 50 vendors that participated with us. A lot couldn't attend today because of work and different things, but we have 50 people, 50 companies on the website in different categories as a resource for everybody out there.
We do. And what I would like to do is just briefly mention the ones that we did not get to see or hear from today in the live feed, just to give those viewers an idea of the types of businesses that they didn't hear from. So the platinum sponsors that we weren't able to touch base with today were Arkansas Blue Cross Blue Shield, Elite Home Health, and Village on the Park of Rogers in Bentonville. The silver sponsors that there was only one that we didn't hear from or about today, and that was NWA Advanced Medical Incorporated. And please know that regardless if they were on today or not, their information will still be on the website, and we still greatly appreciate their support and involvement in this expo. Virtual or in person, they had a presence, and we need to acknowledge that. Comfort Keepers In-Home Care and Up Mobile Dentistry were the two bronze sponsors that we didn't get to hear from today on the live feed. And then as far as the vendors go, Arbor Vitae Chiropractic, we didn't hear from Blue Wave Hearing Centers, but I see that Leah Fitzgerald is logged in, so I'm sure she just got pulled away from work. Brookfield Senior Living, the Benton County Veterans Services, Biotech Pharmaceutical, Bella Vista Courtesy Van, CBD of Bella Vista, Chris Care, Circle of Life, Grandbrook Memory Care, Humana, Highland Health and Rehabilitation, Jeffries Eye Associates, Merkling Insurance Agency, Operation Good Morning and Project Lifesaver. I know we touched on that just a little bit this morning. PRN Medical Services, Rogers Health and Rehabilitation, RMP LLP, Rejuve, Seniors Helping Seniors NWA, the Plaza at Highlands Crossing, and ROSE, which stands for Reconnecting Our Seniors Everywhere. And so to get more information about those vendors and sponsors that you didn't get to hear from today, and to get more information on the ones that you did get to hear about today, visit our website, which is seniorexpo.services. And don't forget, I forgot to mention our gift, or our door prize is a $25 Visa gift card. So we are going to be taking registrations for the door prizes through next week, and we'll announce the winners next Thursday. The only way to register to get a door prize, if I haven't mentioned already.
Mention it again.
Yeah, to send an email to this address. It is seniorexpo.services@gmail.com. All we need is your name and phone number. You'll get contacted on the 24th to get the good news about whichever fabulous door prize you won because you registered and sent an email to seniorexpo.services@gmail.com.
You've been like Jerry Lewis. You have done the telethon.
Don't click delete when you end this meeting, Trisha.
Okay. No, I won't. won't.
This was
all the space on my computer.
I know. This has been a really interesting way to do an expo, but I really enjoyed it. I kind of feel like Jerry Lee Lewis. But you know, the important thing is to get all the information about the senior services that we have right here in our backyards to the people that need it most. So if you're not that person that needs the information that we shared today, I promise you, you know somebody who is. So do the due diligence in sharing this video, share this information so that you can help us accomplish our goal by getting it out there and helping people. Adult Day NWA is an amazing program that is the only adult day program in Northwest Arkansas that focuses solely on enriching the lives of our participants while providing an affordable respite for the caregivers. So that enrichment part is equally important as the affordable part. We are a nonprofit organization and rely heavily upon donations and grants. And so if our participants are not able to pay for our services, that doesn't mean we're going to make them stop coming. We will work with them. We will help give them different resources that could maybe help get them qualified for Medicaid that does cover our services, or hooked up with a long-term care insurance policy that could help cover our services. But we don't ever want to turn anyone down for the lack of their ability to pay for our program if it's a good fit and they get enriched while they're here. So please share that information and share this video. Come by, we can do a virtual tour. We're located in the Frisco Station Mall in Rogers, which is right behind Hobby Lobby. And y'all, we just have a lot of fun. I don't know if you've been able to hear in the background, like the piano playing and the music and the laughing, and it's like that all the time. And it's, some people, it gets on their nerves whenever I'm talking on speakerphone and they hear music in the background and they think it's rude. And I think it's lovely because it's what they're here to do, is to have fun.
Here, there is life going on here all the time. People are coming and just sitting in a chair. There are activities, there's live. It always amazes me when I come in, the few times that I come in, that there's so much life going on here and so much interaction and so much love going on for our participants. You have, Sarah, you have done an amazing job putting together the most amazing team. Everybody so caring, so caring. And I know that because the times that you're not here for various reasons, it's still going on.
Yeah.
There's caring and love and procedure going on. That's when you know that you've done an amazing job. So thank you, Miss Sarah. You have done a great.
I am just thrilled to be able to do it. Just thrilled to be able to do it. And we do have a great team. And yeah, come by, give me a call if you want more information or would like to try out just a trial day. The first day is always free, so there's no financial obligation to just kind of put your toe in the water and see how it feels. We can do that with no risk, just to see how it goes. So my number is 479-372-4185. And our website is adultdaynwa.com. We're also on Facebook. If you're watching this video, somehow you've linked up to our Facebook page already. And I can't mention the program and our website and Facebook without mentioning the radio program. We didn't even talk about that today. On Wednesday mornings from 9 to 10, Todd Watley, the certified elder law attorney you heard about earlier today, one of our silver sponsors, he and I co-host a radio show called Senior Services NWA. It's on Kerm radio station from 9 to 10. It's live. We cover a lot of stuff, all to help the seniors in our community. So you can tune in through the Facebook page called Senior Services NWA. You can call in the show, ask questions. We really enjoy doing it. And what else do we need to put out there? Door prize stuff one more time?
Door prize one more time, yes.
If you haven't registered for a door prize, the only way to get in the drawing for a door prize is to send an email to this address right here, seniorexpo.services@gmail.com. All we need is your name and phone number, and you will be entered in the drawings for all the fabulous door prizes that you saw today. And you didn't even get to see them all because the vendors that didn't make an appearance today still have door prizes. So if you don't think you saw something that was for you, there's so much more, so much more. Okay.
Congratulations, guys. This has been incredible.
Thanks, Sharon. Thank you,
Yeah.
Butts. I didn't know you were still there.
Oh, yes, I'm here. I'm just working in the background. Sarah, you've done an incredible job. Trisha, great technical skills over there.
Thank you.
Okay. I think it's time to tune off, yes?
Signing off.
Okay.